he is my teacher. When I was doing my PG, I was a student. He is passed out from same college in 1991, and he had completed his MD in 2007 from BHMS Nashik. He got opportunity to learn from all the stalwart like MNW Trust, Palgar, Professor, then Shankaran sir, Vijay sir, Sagar School of Homeopathy. And that's the greatness of our college, that our students, wherever they go, they do better in that school. So sir has lots of experience in homeopathy practice. He is HOD of Repertory department in Dr.Santosh Patil Homeopathic Medical College, Sangli. And on our request, he had come here today. So I request Mukadam sir to felicitate him with small token of love. I also welcome Dr. Patil sir. He is also a student of he is practicing homeopath and sir's classmate and colleague. So without wasting time, I will hand over mic to Patil sir to continue his lecture.
Good morning everybody.
Good morning.
सुप्रभात. महिला दिनाच्या सगळ्यांना खूप खूप शुभेच्छा. आणि आज रंगपंचमी असून सुद्धा तुम्ही इथे सगळेजण आलात त्याबद्दल तुमच्या मनापासून अभिनंदन. First of all, it's my pleasure to be here in my original college, Pex Homeopathic Medical College, and I feel very delighted to give my few experiences about homeopathy with you. When I passed out in 1991, and after passing from this college, we have got good modern medicine knowledge, but we have got not much trained as far as how to practice homeopathy. But day by day, by getting exposure to different stalwarts, we gathered the knowledge of how to practice homeopathy. And then later on, initially I was a teacher of anatomy. Once I find out that homeopathy has got such a good results, I changed my subject from anatomy to repertory. Then I started teaching repertory to my college, and because of teaching repertory, I got lot of interest in homeopathy practice, and repertory helps me day in and day out about homeopathy practice. And today we are discussing about this part, how repertory helps to you in day-to-day practice. This is one of the most important tools in homeopathy practice. Without repertory, it is not possible to practice homeopathy. And today's topic that we are discussing is unlocking the case through repertory. Before going into the proper topic of repertory as such, when you want to dive into homeopathy practice, what are the prerequisites that one should know about homeopathy practice? So आपण जसं पोहायला शिकताना आपण बऱ्याच स्टेप्स घेत असतो. And while going into homeopathy practice, what is required for students as a practitioners that we are discussing in a few slides. My great tribute to our master, Dr. Santosh, who has invented this beautiful science, and because of him that we are here to practice homeopathy in a better way. One of the foremost requirement as far as homeopathy practice is concerned, one of my teachers always asked me, what is the foremost requirement of homeopathy practice? So students might say that we should have a good knowledge of Materia, Medica, we should have a good knowledge of Repertory. But what is most required part, the most basic aspects about this, what my teacher always says, is that we should have a strong faith in our science, that it works. Unless and until you have a strong faith in our science, it is not possible to practice homeopathy. तुम्हाला स्वतःला जोपर्यंत आतून साक्षात्कार होत नाही की माझं सायन्स ऍक्ट होतंय, our science works, it works not only what anyone talks about it, it works unconditionally. You can take from common cold to the cancer. We have seen the cases where they can be treated with homeopathy, or simple common cold to the most difficult cases like cancer can be managed with homeopathy. But before this, what we require is a strong faith in our science. In one, my teacher always used to say, "तू काय तुझा बाप पण homeopathy बराबर." So असं बऱ्याचदा ते म्हणायचे. So that much amount of strong faith in our science, that is most foremost requirement. Then later on the knowledge of Materia, Medica, Repertory, organ, that comes later on. But main part is this: one should have a strong faith in our science. Then another part in our practice that what homeopathy requires, that I make a difference in sick individual. आपण समोरच्या पेशंटच्या आयुष्यामध्ये काहीतरी बदल करू शकतो. And this is only possible with homeopathy. Most of the patients say, "Doctor, मला आता पूर्वीपेक्षा I feel very free." Before this is what we mean by very free means I am going to become a normal human being as compared to my past illnesses as concerned. So this is one of the part. We make a difference in patient individual. What we say, we can change the horoscope of a patient. आपण पेशंटची कुंडली बदलू शकतो. पेशंट बऱ्याचदा लाईफमध्ये कुठेतरी अडकलेला असतो, त्याला पुढे जाता येत नाही. बिकॉज ऑफ सम disturbances at the level of mind, he cannot go in front in his life. So with single homeopathic proper medicine, we can make a difference in patient's life. That is one of the most part. I make a difference in patient's life. That should be your motto as when you are going into homeopathic practice. Then you should develop your skills. Especially as far as skills are concerned, most important part about developing the skill is concerned. What we mean that homeopathy is a science and more an art. As compared to, it is science, no doubt about this, but to understand this science, to have a amount of skills. And specifically, what I say to you, if you got a mastery over case receiving part, if you got good mastery over the case receiving part, most of the half work is done. What Margaret Tyler used to say, good case taking is a half cure. This is what Doctor, you heard about this. Why it is called a half cure? Because once you taken down the case properly, your half job is done. You are arrived at a proper civilization. Then from finding the civilization to the patient getting totally cure of this is called as a half part of this. Why it is called as half cure? Good case taking and a half cure. Half means you arrive at a civilization. And once you prescribe a civilization, then patient came to you for follow-up 1 month, after 2 months, 3 months. He will get totally cure about his illness. That is a half part of it. That's what Margaret Tyler said. Good case taking is a half cure. So one of the most important part in homeopathy, सगळ्यात बेस्ट पार्ट काय आहे, वन शुड एबल टू हॅव अ गुड स्किल अबाउट टेकिंग द केस इन डिफरंट सिनेरियो. वेगवेगळ्या प्रकारचे पेशंट आपल्याकडे येत असतात आणि प्रत्येक केसमध्ये आपण कसं जायचं, दॅट इज वन ऑफ द आर्ट, अँड दॅट आर्ट हॅज टू बी लर्न फ्रॉम डिफरंट मास्टर्स. सो दॅट्स वाय माय टीचर डॉक्टर शंकर यूज टू से टू टू learn homeopathy, sit with one of the experienced physician and try to understand how he asks the questions, how we go in the case, how we prescribe the medicine, how we choose the rubrics in the practice. That is the most part. That's why you should have a good teacher, and you should always sit side with and find out, see how we prescribe in each and every case. That's why developing the skill is one of the most important part of it. Then you should have a good genuine care of a patient. Patient बद्दल तुम्हाला खूप आत्मीयता पाहिजे. माझा पेशंट बरा व्हायला पाहिजे. Patients have a lot of amount of sufferings are there. Unless and you feel that my patient should get better, you should have a genuine from the heart. You should feel that patient should get better. So this genuine care of a patient. Then purity of your own soul. Your intention should be always good. It is not the money making part of this. Money will come automatically. One should give a good results in your practice. Money will come automatically, but you should have a good intention that I have to take honestly this case and I have to try to find out the best remedy as far as possible. Dr. R.P. Patil, you heard about, you are using this book in second year, this art of case taking and repertory. He used to say you have to treat a single case properly. This single case can build your whole practice. That is most time. Whenever any new patient came to you, I always try to find out you should give a best result to you, because this patient might be develop their whole practice your whole life. That is one of the one part. So that's why you should have good intention that I should take a 100% of efforts from your side to that, see to that this patient get better from your homeopathic medicine. Another part that what I find out is, when I passed out in 1991, we are well educated. We have a good teachers of Materia, Medica, we have good teachers of organ and medicine, all best teachers in our college. We have got good knowledge. I was one of the ranked students in my college during my time. But we are not well educated, but what lacking is this, we are not less training about how to practice homeopathy, how to fishing, this one of the part we are talking about is fishing in homeopathy science. Fishing आम्हाला कोणी शिकवलेलं नव्हतं, fishing कसं करायचं. That's why I used to say we are well educated but we are not well trained. Should have a good training and your best teachers. During bedside part, this bedside from the patient समोर आला त्या patient मध्ये काय बघायचं आणि patient ला काय prescribe करायचं. Unless and until you get this training of this aspect, it is not possible to practice homeopathy. That's why I always choose to say we are very educated and should be well trained. आपल्याला training चांगलं मिळालं पाहिजे. So that's what, how, as per most of students, how we get training about this. This I always say with these 3 E's of this. Most of the students are our passed out students from our college. They are doing general practice. I was also doing general practice during my initial days of practice because we are well trained from all sorts of the modern medicine, pharmacology, and how to handle different types of allopathic cases, modern medicine cases. Because we have a good exposure of different hospitals at our college, but not much exposure about homeopathy practice during our times. But when I go into general practice, what I find, we have a good number of patients at your hand. You are good general practice. What we mean? So you have 30, 50, 100 patients that you see in day in and day out. That is one of the part you should have good amount of exposure. And once you have a good exposure of a patient, you have learned that you have learned homeopathy in our college. Then try to experiment on this patient. This is what I learned. I have developed my practice. So I have a good number of general practice. So I know few about how to prescribe lycopodium, how to prescribe peridone, how to prescribe silica. I slowly started giving medicine to this patient. So I try experimentation on the patient. I may give some placebo to the patient from B-complex and all, but along with this I am prescribing homeopathic medicines. The patient doesn't know that this is medicine, I am giving homeopathic medicine. So during initial days of my practice, I used to develop like this. So I do experimentation on different types of patients. And when I experiment, some patients got better. When patient got better, I got good experience of this. And once I got good experience, I got to develop my confidence that homeopathy works. So that's why I always ask to the students who are doing general practice, you are at very good command. You can able to develop homeopathy practice as fast as compared to the person who is doing pure homeopathy practice. Because you have a good number of exposure. And patient in general practice, you have a good patients who have a good faith on you. तुम्ही काय त्या राग जरी दिली तर ते अगदी मन लावून घेत असतात. That is one of the best part of general practice. So you should have, so that I always build exposure, experimentation, and experience. This is one of the main part that how I turn into homeopathy. If you see this one book, I always go to anywhere in lectures, so I always believe in this part. After C.M. Gogar's, there is one book called as Gogar's Synoptic Key. And in Gogar's Synoptic Key, he has mentioned these 3 points about successful prescribing. About success. You see the way of words of Dr. Gogar. Try to imbibe these words by Dr. Gogar. But first word, he talks about the successful prescribing. What is prerequisite for successful prescribing? Successful prescribing साठी काय prerequisite आहे? This one part. So one of the first part he talks about is the words used by Gogar. Just remember this: spatial aptness. This is part of the spatial aptness in grasping the essential points of symptom unit. This is what we mean by case taking part. What we are talking about case receiving part. So this is how we are talking about which aphorism. Which aphorism he talks about this case receiving. So this is what we mean by spatial aptness means what? Spatial, you should have a spatial art. You should have a spatial knack of digging out the symptom from the patient and try to find out which are the PQRS symptoms in a case and then prescribe on this. So this should have it is not only just case review. What he mentioned about it, you should have spatial training. You should have a spatial aptness in grasping the essential points of symptom image. Symptom image means what? What is to be cured in each individual disease. What is to be cured in each individual disease. We are talking about aphorism number 3. We are talking about aphorism number 3. So this aphorism number 3, what we call it is a miniature of organ. It is called as miniature of organ. And one the homeopatician physician who has understood this aphorism, who can become a successful prescriber. You have to understand this. So this one part we mentioned about spatial aptness in grasping the essential points of symptom image. The second part So one of the this case I want to discuss with you is about the special apnea grasping the essential points of symptom. There was a case, it is not a case of mine, it is a case of one of my teachers. This lady, around about age of 50, she suffered from multiple weight complaints that she has got tingling numbness all over the body, she has got myalgia like pain. Along with this, she has got sleeplessness. Main complaint was sleeplessness. So initially she consulted with general practitioner. General practitioner has given some medicine, some tranquilizers, but it is not, her sleeplessness is not getting better. All aches, body aches are not getting better. So general practitioner referred this case to the MD medicine. Then again, when MD medicine has seen this case, but again this is not getting good results with general medicine. So general medicine thought this might be a case of some neurological part. So he consulted to the neurologist. So neurologist again gives some, like you have to gabapentin and all, you heard about this. Alumni medicine which pulls down the nerves. Then without any much effects of pain as well as sleepiness. Then he consulted to the psychiatrist. But after going for at least for 1 year, he is going from one doctor to another doctor, not getting better. Then ultimately after 1 year, she consulted to one homeopath. So this homeopath asked this lady how it started. So what this lady talked to you, it started, she is my date of husband. So what you want to prescribe for this lady? It started with date of husband. So elements from what? Loss of loved one. Okay. Loss of loved one. So your husband is your loved one. Okay. Any other part? Element from suppress. Why it is suppressed? It is element from Greek only. Element from Greek. So which remedy you are thinking in your case? Matron. Any other? Ignition. This is what we usually think into this case. This is what we have learned from our Medica. We have learned from Ignition. Ignition is one of the remedies for recent trip. So this remedy was given by this edition remedy, Ignition, from 200 mm to 10 mm potency, at least for 3 months. No any change in her sleeplessness and body ache. Then again he shifted to the natural mode. It might be a long-standing, it is after 1 year, prescribed natural mode, but without any change. So ultimately this case gone to one of my teachers. The teacher asked the first question. What are you talking about this spatial apnea? One should have a good knack of understanding the case. He asked first question, what is your experience? What is your experience when your husband died? What is your तुम्हाला काय वाटतं तुमचा जेव्हा नवरा वारला त्यावेळी? And normally we expect I feel मला खूप दुःख झालं, मला खूप वियोग झाल्यासारखं वाटतं, माझा नवरा गेला. So the answer was about this lady was, this is one of my most joyous moment in my life. This was the answer from this particular lady. Just try to understand this. So this is what you have to understand this. Try to understand what patient feels in any circumstances. It is not your feeling, because our feelings are most of the time biased on basis of our experiences. But the another part is it is based on our knowledge basis. So knowledge and experience make us more biased. What we talking about prejudiced. What anyone talks to you, one should be unprejudiced in any case. Unprejudiced means तुमची party जी आहे, slate should be totally blank. You don't know what comes from the patient. So ultimately this lady gives the answer. This is one of my most enjoyable moment in my life, because till my husband is there, it is just like my life is just like an hell. He drinks day in and day out. He just collect money from me and he spends on the alcohol. And once he died, so I feel very relaxed. I feel very free. So she feels very excited after the death of her husband. So remedy was prescribed is not for ailment from grief, it is ailment from excessive joy. It is from ailment from excessive excitement. The remedy was given as Kokia Kura. So this is how, this is case from my teacher Dr. Santosh. So this is why to understand this, try to go into shoes of a patient. Try to go into shoes of patient. So what we talking, we are taking down the case, life space and analysis. You heard about this. Patient से अपन life space घेतो. Life space मध्ये घेताना काय करायचं असतं? What you have to understand? In any situation of a patient life, it might be in the childhood, it might be in the school days, it might be in family, it might be in a work area, it might be in anywhere. Try to on any situation given by a patient, try to ask the patient what you feel at this particular situation. तुम्हाला काय वाटतं? So what is your experience at this particular circumstance? That gives about his individuality. not your age, because we try to see from our specs side. जसं आपल्या डोळ्यांना आपण बघत असतो, आपल्याला ती माहिती आहे. So don't do like this. Always try to go in the shoes of a patient. Try to understand what patient experience in any situation. That is one part. That is we're talking about case taking part. Just remember this. Second part, what he mentioned about this great drudgery. He had mentioned about this. It is not great knowledge as what you are talking about. Great drudgery in mastering this. Master हा part आहे. This you should be master. आपण ज्याला master of म्हणजे MS झालं की master of science. This is mastering any science असतं. So mastering. And then he will use the word working knowledge of mathematics. It is not only knowledge of mathematics. He mentioned about this word working knowledge of mathematics. Means what when you read the mathematics, you should be able to apply this in practice. That's right. You should apply this in practice. This is what we mean by this. This is a working knowledge of mathematics. So this working knowledge of mathematics, one should have a good knowledge of this. I have learned this from Dr. Dubey. You heard, you are reading this book of Dr. Dubey. Dr. Dubey was one of the he's walking, talking mathematics. He knows each and every line of Alan Skinner. Just remember, it is not only just by heart of Alan Skinner, but he knows how to apply a knowledge of Alan Skinner in practice. Alan Skinner in practice. So that I learned from Dr. Dubey. He has shared his lot of number of cases when he came to Kolhapur long back. During when Dr. Bune's 100 years of practicing number वर्ष झाले, Dr. Dubey came to Kolhapur and he has taught us one remedy, tuberculin. And this he was talking to tuberculin for almost for 2 days from 9 to 6. Only one remedy. With its different application. When you read Alan Skinner, he just go from in Alan Skinner you have heard about it. In bracket they are given along the closer remedies. So you go once you read one sentence and another closer remedy, discuss about this remedy. So he has taught us tuberculin for at least 2 days, and from him that I learned how to understand mastering the working knowledge of mathematics. So just I share one case of one of my student. I was treating this student for amenorrhea. And I was treating her as a constitutional remedy. Like I was given initially pulsatilla, then silica, calcareca, but her menses are not coming. It is almost like 7 months. She has got answer. So luckily, this student came with me to this seminar. So Dr. Dubey, in between the break, he was just sit in the auditorium. I just go and meet sir, and I asked her, this is my student, and I am treating this girl from such and such complaint. Dr. Dubey just, this is what we mean by this, what experienced physician always try to understand. You just look from above upwards. So this is what we mean by screening the patient. तुम्ही जेव्हा पेशंट तुमच्याकडे येतो त्या पेशंटला तुम्ही वरून खालीपर्यंत बघा. पेशंट कसा दिसतोय, पेशंटची केस कशी आहे, डोळे कसे आहेत, नाक कसे आहे. So this is what we are talking about point number 5. Ascertainable physical constitution of the patient. This is what we mean in allopathy also we do the screen the patient. So this Dr. Dubey just see this girl from above onwards. And then he asked this girl how it started. So she said, doctor, I have suffered from hepatitis. 1 year back. And after this hepatitis, my menses are not coming regular. Now I am suffering from this amenorrhea. This is one first question. The second question asked by Dr. Dubey, how is your mood? Then she said, doctor, I feel very depressed. I feel very sad. मला असं उत्साह वाटत नाही, खूप नाराज वाटतं असं लाईफ मध्ये काही उत्साहच नाही असं वाटतं. दिस इज द सेकंड क्वेश्चन. then Dr. Dubey asked me, he just नीचे तुम्हाला पीठ नीचे करवायचे बोले Dr. Dubey, and he just pat on my back. Dr. Patil just go and read Alan Skinner, this and this remedy, second page, first 2 lines, and prescribe this remedy. This is how he talks to me. Only with the 2 questions he given the remedy to this girl. You just read this Alan Skinner. The remedy was prescribed to this girl was Helleboris. And you just go and read Helleboris from Alan Skinner. It is mentioned there. Menses fails to appear after any infectious disease. As this is mentioned. This hepatitis is what it is with melancholic mood. So this is what we mean by understanding the practical application of mathematical. I prescribed this Helleboris 33 doses. Within 8 days our menses started. So this is what we mean by this. So this is one part. This hepatitis has done this part because of this hepatitis he suffered from amenorrhea, and along with this the mood of a patient, state of disposition of the mind of this girl. So on this basic prescribed hello. So we have so many number of such cases. Dr. Dubey. So that Dr. Dubey just try to find out what exactly this patient is, and then he referred this to the knowledge of mathematics. So This I learned this from great trustee. Just remember this, when you are reading Materia, always try to understand how one should able to apply this knowledge in our practice. That is one most important part of this. I always believe, Doctor, you might not expose to one of our best teachers, Dr. Mane sir. He was one of the best teachers that I learned Medica from him. He just said, aggravation from motion, aggravation. So any complaint, aggravation from motion, always think of Brian. So anywhere in this complaint. The way of his teaching was such a like that. He has taught us so many number of medicines and he has practiced this in his practice. That's why we are very much learn from Dr. Mane sir about how to apply knowledge of Allen's. We used to teach only Allen's keynote and how to apply Allen's keynote in practice. So just remember this part, great surgery mastery, working knowledge of maternity. And the last part is skillful use of many books of reference. This is what we mean by skill. Just remember this part, skill of using repertory. This is part, skill of using repertory. How to use repertory in practice. The repertory knowledge nothing other. You have to understand what patient talks to you and how do you convert into repertory language. That is one of the most. If you convert it correctly, then and then only you can find the exact rubric in a case. So to this, I want to just. This was a lady. This was one of my friend who was suffering from headache, and the peculiar modality of this headache was like this. He took us and he says, whenever I sleeps more, normally his habit of sleeping from 11 to 6. 11 to 6 is the usual habit of this person of sleeping. Whenever I sleep till 8 a.m. in the morning, I get headache. It is not sleep after. Sir, तो क्या मतलब कि ज्यादा दिवशी मी जास्त झोपतोय. Whenever I get more sleep, I get attacks of headache. Whenever I get normal, जेव्हा रेग्युलर झोपतोय तेव्हा मला डोकं दुखत नाही. मी ज्या दिवशी एका दिवशी जास्त झोपला जातो त्या दिवशी मला फक्त माझं डोकं दुखतं. So how to understand this? How to understand this? This was a rubric which is given in a repertory that is called as, that we go into generality chapter. Generality, there is one rubric called as sleep, long aggravation. That's all. Sleep, long aggravation. And the remedy was given to this, my friend was lachesis. Lachesis has got aggravation, sleeps after aggravation, you know about it. But this also has lachesis 3 marks in the repertory. Long sleep aggravation. One patient might, this is one part, another patient might, डॉक्टर मला दुपारी झोपून उठली मला सुस्ती वाटते फार सुस्ती वाटते. आय फील व्हेरी डल लेझी वेन आय टेक आफ्टरनून स्लीप. जेवल्यानंतर 5-10 मिनिटं झोपले की मग माझा दिवस फार खराब होऊन जातो. अँड आय फील व्हेरी डल अँड लेझी आफ्टर आय टेकिंग द आफ्टरनून स्लीप. दिस वन पार्ट. इट गोइंग टू रिपीटेड रुब्रिक कॉल्ड डलनेस सिएस्टा आफ्टर. दिस डलनेस सिएस्टा म्हणजे काय वार्म टुक्षी पण म्हणतात. त्यामुळे दुपारी थोडं जरी झोपलं तरी मला सुस्ती येते. सो दिस रेमेडी वॉज ग्राफायटिस. सो रेमेडी, सो शुड, दॅट्स वाय यू शुड remember, you should know repertory in and out. You should know repertory in and out. Then it is possible to use this in practice. So always remember this. If you master about these 3 points, your practice will be endless practice. This is one part. Knowledge of case taking, Medica, and repertory. So this is what we are talking about. Aphorism number 3. One should be very imbibed with this aphorism number 3. Then aphorism number 83. These are few points: freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture of a disease. You should be always there. So this attention in observing is also one of the important part of this. So you should be very attentive about this. Then aphorism number 153. This one part that most striking, singular, uncommon, peculiar signs and symptoms of the case are chiefly and mostly written kept in your book. So this is PQRS, something PQRS. It was a case of one of my friends' boy, son. He was getting fever day at least for 1 week, not getting better in spite of taking different homeopathic medicines. Plus, along with this allopathic medicine also, he was not getting better. But whenever he feels when he has got fever, he always asks the father, "You open my shirt, coat shirt." त्यामुळे पोटावर काय कवरिंग नको आहे. सो शी ऑलवेज यूज टू लाईक टी शर्ट घातला असं टी शर्ट असं वर करायचं आणि मग झोपायचं. सो आज दिस फादर, वाय यू लाईक दिस? आय फील मच बेटर अबाउट दिस वन्स आय ओपन दिस. दिस वॉज ॲक्च्युअली समथिंग अनयुजुअल सिम्पटम फाइंड आउट ड्युरिंग केस ऑफ अ फीवर. देयर इज दिस इज वन सिम्पटम इन रेमेडी कॉल्ड uncovering the abdomen amelioration. Uncovering the abdomen amelioration. The remedy was given of tabacum. So this tabacum has got this symptom. Which is if you tabacum can be used for renal colic also, but This symptom is one of the PQRS symptom of TB, uncovering the abdomen amelioration. This is what you mean. So always try to find out PQRS, something peculiar, pure, rare, strange symptom, because that's why I always say to the students, to the BHMS students, we are always a double graduates. Why we are double graduates? Because we have to understand the clinical part, what this patient is suffering from. So that's why clinical acumen should be very good as far as homeopaths are concerned. This one part we are diagnosing, we have got all the knowledge of modern like medicine, preventive and forensic medicine, gynecology surgery, all subjects are taught to MBBS is also taught to you. This one part. That's why we are very much acquainted with the clinical part. So first we have to understand the clinical part of the case, clinical diagnosis, and then we have to understand person diagnosis. Who is the person who is suffering from sciatica? अच्छा sciatica कुणाला आहे? नक्सुमिकाला आहे या बेलाडोनाला आहे या पोलोसिनला आहे? This is one part. So you have to understand two part in a case. You have to understand clinical part. You have to understand the person part. So that's why I always say to the student, our BHMS course it is just like we are double graduates. You have to understand man. This is as well as you have to understand man in this. This is one part. So always you should be proud that we are a double graduate like this. This according to 153. So what we mean by essential points of symptom image, that's we are talking about this Dr. Bogart. This I want to narrate one case of this first case of anal fissure. I was doing my Repertory training at Palgar Hospital, and there was a case of a old farmer came to our screening OPD. And screening OPD he says, doctor, I got bleeding per rectum. I got bleeding per rectum. So usually we examine this bleeding per rectum. So this case was referred to surgeon. Any other complaint this farmer has, but it doesn't have any other complaint. He just only say, I got bleeding per my rectum. Only bleeding. So there is no any pain, there is no any burning, nothing like this. So bleeding per rectum without painless bleeding, so we are thinking it might be a case of malignancy or something like this. So we referred this case to surgeon. Surgeon done the proctoscope and he has given this remark that this is a case of anal fissure at this particular block. The different positions of anal fissure. So this was his remark for the case paper. So we go to our teacher. This was a case. The teacher, without looking into this case of anal fissure, and this patient has not only bleeding, there is no any pain. So what we mean a negative general. You heard about this. That's this is negative general symptom. This patient doesn't have any pain, there is no any burning like this. So teacher just look into this and he prescribed some medicine. So we are finding how he prescribed this medicine. So after 8 days, this farmer came to our OPD for a follow-up, and he said my bleeding from the next day, our whole bleeding stopped. So at that time we asked our teacher, how we prescribe these medicines. Then he asked us to go to the repertory. It is not given in Kane's repertory. If you have Kane's repertory, there is one rubric called painlessness of complaints, which are usually painful. You know that what is main symptom of fissure is pain. What's the main complaint of the fissure is intense pain. In case patient will be doctor, pain. But this case, there is no pain. This is what we mean by this is a negative general symptom. So this is a rubric called painlessness of complaints, which are usually painful. In Kane's repertory, there are only 3 medicines. One is hellebores, another is stramonium, another is opium. There is no any addition to it. You just go into works on Kane's repertory. This is one of the repertory written by other authors. So Shivaraman works on Kane's repertory by Shivaraman. This is a repertory which he has worked on Kane's repertory. So he has added one medicine in this. He has added one medicine. This medicine was, you just go and read Patak's Materia. What Patak mentioned about this remedy, absence of pain when it is expected. Absence of pain when it is expected. What we are expecting in the case of fissure, there must be a pain. But here there is painlessness. So the remedy was prescribed to this case was antimonic fluid. We just try to understand how antimonic fluid. So antimonic fluid has got action on orifices. Antimonic fluid has got pathology like cracks and fissures. And antimonic fluid has got absence of pain. We just thought this is what is to be curative of this case. Also cracks and fissures, orifices and painless. So painlessness of a complaint this is a first ranking symptom in a case. We want to grade this symptom. This is the first grade symptom, the cracks and fissures, the second grade, and the third orifices is the third symptom. If you want to do the symptom, I actually arrange the symptom according to organ evaluation of symptom. You understood this. So this remedy was just read and Patak's Materia. You can read Boric also. Boric has mentioned about this absence of pain when it is expected. So So Dr. P. Shankar used to say how to learn Materia Medica. How you learn Materia Medica. He used to say like this: read, think and observe. Or observe, think and read. Observe, think and this is the best way to learn Materia Medica. I always believe in this. Means what? You have to read this. You have to read this. Remedy, you are reading the remedy Asculus Hippocastani. You are reading the case Asculus Hippocastani. And you are reading the severe lumbosacral backache with nearly all complaints. As I mentioned here, Asculus. Severe lumbosacral backache with nearly all complaints. And this was then I read this. So you have to read this and then think what do you mean by this? Thinking of this means nearly with all complaints. If you got any complaint like Asculus has got leukorrhea, Asculus has got prolapse, Asculus has got piles, Asculus has got pharyngitis. There are so many number of complaints. Asculus has ability to cure this. You usually know it is only a pain like sticks. Hemorrhoids you know about Asculus because we read this prominently. But other aspects of this, but prominently what you find in Asculus, this symptom is severe lumbosacral backache with nearly all complaints. And this was one lady who came to me. To her, I was prescribing platina so many number of days. But this lady got not getting better with platina. And one day she came with acute pharyngitis and she said, Doctor, whenever I get this attack of pharyngitis, I have severe lumbosacral backache. So I read this from Alan's keynote. That this is one part, Asculus I mentioned, that the severe lumbosacral backache with nearly all complaints. And Asculus is one of the remedy for recurrent pharyngitis when exposure to cold air. This is one part. Acute coryza and pharyngitis. So I prescribed this lady Asculus and found this Asculus pharyngitis is totally got it. So you have to read, you have to think about this, how patient might present to you and observe in your patient. Or opposite part, you go in a case, try to find out what is something peculiar about this case. And then think about this. What might be peculiar about this case? And go and read the Materia. This was a boy around 6 or 7 years complaining of severe abdominal colic. I visited her home and during the pain, he always asked mother to press his umbilicus. So along with the pain in abdomen, he has got colic pain in abdomen. Another symptom, he has not passed stool since last 2 or 3 days, but if you pass stool, it is just like a naughty stool. गोल गोट्या कशा असतात तसे जरा संडास 1-2 खडे पडायचे तेवढंच पण he has got continuous pain in abdomen. And this boy always asked mother to press his abdomen. But not only just pressing, ask mother to press hard and hard. जेवढं जोरात दाबता येईल तेवढं दाब असं सांगायचं आपल्या आई. This is one part of this. And along with this, when we lie down in a bed in some very strange posture, म्हणजे त्या झोपताना एक पाय असा लांब ठेवला होता, एक पाय स्ट्रेच केला होता, दुसरा पाय मग पोटात जवळ ठेवला आणि असाच झोपला होता तो in a bed. So there is one rubric in a repertory called as attitude bizarre, attitude strange. This is one of the rubric in a repertory. Attitude मी केनच्या repertory मध्ये बघा माइंड मध्ये attitude bizarre म्हणजे काय? Bizarre means something strange attitude. But along with this, I observed this patient, this boy has suffered from colic pain in abdomen. This boy has got constipation, and this boy feels better by very hard pressure. To collect all these symptoms, make a totality of this. The remedy comes is any remedy, for patient who has a hard knotty stools, abdominal colic with constipation, with Brian alba. So Brian alba, you don't have a hard pressure ambulation and constipation. Brian has no doubt about this constipation, but this typical hard knotty stools, one part. Chamomile. So this one of the remedy, you just go and see into this abdominal colic with constipation, hard pressure ambulation, and attitude of the remedy was plumbum metallic. So just read this remedy plumbum. So this is what we mean. So I observed in this child something strange attitude about this hard pressure. So I observed this, I think over this the case, and then I read into Materia Medica. So this is one of the best way to learn Materia Medica. This is taught by Dr. P. Shankar. P. Shankar was father of Dr. Rajan Shankar. There are 2 books which has to be read by every homeopathy who want to practice homeopathy. Elements of Homeopathy, Volume 1 and Volume 2. All the basics about it, not hi-fi Materia Medica and all this. More basic Materia Medica which are written. Not only Materia Medica, he writes about pharmacy, he writes about Materia Medica, he writes about Repertory, he writes about philosophy. So all the topics are included in these 2 volumes. Elements of Homeopathy by Dr. P. Shankar. So then mastering the working knowledge of Materia Medica. Should always, what do you mean by mastering working knowledge of Materia Medica means what? Means you should, what is, we are talking after number 3, what is to be curative of each medicine. प्रत्येक मेडिसिन मधला क्युरेटिव्ह काय आहे? व्हॉट इज टू बी क्युरेटिव्ह ऑफ ईच मेडिसिन? व्हॉट डू मीन बाय दिस? This is called a genius of each medicine. What is called a genius of each medicine? To try to give me this idea about antimony tart. So this genius of medicine has to be there when you want to prescribe antimony tart. You can able to prescribe antimony tart for respiratory problem like asthmatic bronchitis insulin. You can able to prescribe antimony tart for diarrhea. You can able to prescribe antimony tart for acute pharyngitis. You can able to prescribe antimony tart for influenza. Any of the provided you have symptoms of antimony tart. Which are the symptoms of antimony tart? That you have to understand this. This is what we mean that. What is to be curative of antimony tart? What is to be curative of antimony tart? So just remember this part. There is a much drowsiness. There is a much drowsiness, debility, and fluid characteristic of the drug. Which groups? What we mentioned about which group should be always be more or less present when drug is prescribed. When drug is prescribed. So this is what we mean by this. This is the genius of antimony tart. This is the genius of antimony tart. In each and every case, we should look into this. So it might any of the diagnosis try as don't bother about diagnosis, but try to find out these symptoms should be more or less present when drug is to be prescribed. So just remember this part. This is antimony tart. This is when talking about antimony crude when you are talking just about and absence of pain when it could be expected is an OPC level. Just we are talking about a case of a patient. And along with antimony crude has got symptoms of mind as well as gastric spear. Stomach disorder, असं म्हणलं जातं. Stomach disorder is the main symptom. It's main concomitant symptom of antimony crude. Stomach disorder. When समजा how to understand antimony crude? एक चाइल्ड असेल समजा तो उन्हाळा आहे बघा. उन्हाळ्यामध्ये तो पोहायला गेला. सकाळच्या दुपारच्या 12 वाजता सुट्टी आता शाळेला परत पेपर संपलेत. दिवस पोहा 2-3 तास पोहून आला. उन्हामध्ये तापत्या उन्हामध्ये आंघोळ केली. This is cold bathing when heated. Cold bathing when heated. And he came in home and he has started with nausea and continuous vomiting. Nausea and continuous, he becomes so much irritable. This is one part. Your stomach get disorder with a part of the fever. You can think of remedy like antimony crude. Antimony crude precipitating cause that you become taking cold when you become heated. This is one part. And along with this concomitant symptom is stomach disorder. Another part irritability of antimony crude. If you just collect all these symptoms, you can prescribe antimony crude. But just remember this part. Gastric spear is one of the main part of antimony crude. You can prescribe antimony crude for gout. You can prescribe antimony for articular. You can prescribe antimony for corns. Any other can provided there should be a stomach symptom as a concomitant symptom in antimony crude. Just remember this is what we mean by what is purity of antimony crude. This is one part. What we are talking about asculusis. This is one part. This is characteristic package with absence of actual constipation. So this one part asculusis has got severe lumbosacral package with nearly all components. You should always read like this. Then we are talking about this today's topic need of repertory. This part of need of. So this need of index was first cleared by Dr. Hahnemann himself. It was first cleared by Dr. Hahnemann himself. So that's why Hahnemann has written one repertory. Which repertory Hahnemann has written? Hahnemann ने repertory लिखने का प्रयत्न किया होगा. This one part. This book is called as Fragmenta de Viribus Medicomentorum Positivis. This is a book of Materia. This book is Latin मध्ये नाव आहे. Fragmenta de Viribus Medicomentorum Positivis. Actually, English meaning is like this. It is a positive effects of drugs on healthy human beings. Positive effects of drugs on healthy human beings. And this book contains initial part Materia and the next part is index. This actually Hahnemann has actually started writing about the repertory because he finds that it is not possible for him to remember each and every symptoms of so much crude drugs with lot of thousands of symptoms. Because that's why the human brain is not possible to remember each and every symptoms of our mathematics. आपल्याला फक्त सिम्पटम लक्षात ठेवायचे नसतं तर सिम्पटमची इंटेन्सिटी पण लक्षात ठेवा. म्हणजे डिझायर फॉर ओपन एअर पल्सला म्हणजे 3 मार्क्स आहे. कॅल्क्युलेटर काय आपला 1 मार्क आहे. सल्फरला 2 मार्क आहे. सर दिस यू हॅव टू नॉट ओनली हॅव टू रिमेंबर द सिम्पटम बट यू विल टेक इंटेन्सिटी. You get sense. That's why it is not possible to remember each and every symptoms of a mathematical to human brain. That's why Hahnemann finds there should be one index which to be consulted when we want to find out any symptoms. So this was the first need of index spelled by Dr. Hahnemann. Then we talk about this is definition of repertory. Repertory is an index to homeopathic mathematics. Just remember this first part of this. Then where the signs and symptoms are arranged in systematic way. Hence, repertory is one repertory which is arranged in systematic way. With 37 sections according to anatomical parts of the body, mind up to gender. You know about this. It is arranged in systematic way. Or there are some repertories which are arranged in alphabetical way, like Patak's repertories. Pathaks repertory arranged in alphabetically with their respective medicines, and its grades, 3 marks, 2 marks, 1 mark. This is how you have to understand the repertory part. Then one part, use of repertory. When they going into exam, you are writing down there are more than 10-15 uses of repertory. There are more than 10-15 uses of repertory. You just read any book of Khanaj, book of Tiwari, they mention about uses of repertory. But what is the main use of repertory from which the birth of repertory takes place in the first part of this? Who is father of repertory? Dr. Boninus. Dr. Boninus. Why he is called as father of repertory? One part. He is the one person who has written the first official repertory, that is called a repertory anti-storing medicine. Repertory anti-storing medicine in 1832. This is one part. The second part, he has started with the idea of gradations. This is one part. He started with the idea of gradation. That's one. That's why Boninus is likely to be called as father of repertory. So that is the first official repertory published to it is published by Boninus. The preface to this repertory was written by Dr. Hanima. This repertory anti-storing medicine. So he then started about this gradations of this. He started about this gradation, giving gradations into this. This is again done by Dr. Boninus, 5 marks, 4 marks, 2, 1 mark. All this is given by Dr. Boninus. So what Boninus will be, just go and open the first page of Boninus therapeutic pocketbook. Boninus therapeutic pocketbook to be used at a bedside. So what he mentioned about the books, the main use to be used at bedside. When you are going to bedside, when there is a patient in the samur, you can go in IPD and see the patient. To be used at a bedside. This is the first use of repertory. Main use of repertory to be used at a bedside. Boninus therapeutic pocketbook to be used at a bedside. The next part, to in the study of maternity. And these are the 2 uses which are told by Boninus, who is the father of repertory. So this one of the main use of repertory is to find out the needed symptom and signs given by a patient in the clinical practice. Patient तुमच्याकडे येतोय. Yesterday I had one boy, girl, मुलगी आली होती. ग्रंथा मोरे म्हणून नाव आहे. तर ती बाबांनी कशासाठी घेऊन आलते माझ्याकडे? ती म्हणजे डॉक्टर की आता अलीकडे बदलले फार. म्हणजे बदलले म्हणजे काय? अलीकडे सारखी म्हणते मला ग्रंथा दादा म्हणायचं. मला दादा दादा म्हणायचं. मी म्हणजे तुला काय ग्रंथा दीदी किती गुड गर्ल आहे. डॉक्टर दीदी म्हणू नका मला रेकॉर्डिंग मध्ये मला दादा म्हणायचं. सो रिसेंटली फॉर अबाउट 2 weeks शी हॅज व्हॉट इज चेंज इन दिस. तिला मुलीचे कपडे, तिला मुलीचे दुकानात ती सारखं तिला टी शर्ट पाहिजे, पॅन्ट पाहिजे असं सारखी म्हणायचं. घरी कुणी पण तिला हाक मारली मला दादा म्हणून हाक मारायचं की दादा मी घरचा बॉस आहे असं. ती राऊंड अबाउट 4.5 वर्षाची मुलगी, 5 वर्षाची मुलगी आहे. दिस इज कॉन्स्टंट टॉकिंग मला दादा म्हणायचं. आय यूज टू जीन पॅन्ट पाहिजे, टी शर्ट पाहिजे, मुलासारखं वागायला पाहिजे. डॉक्टर ही काय ऐकतच नाही अजिबात. शाळेला जाताना पण तसंच, कारण घरी पण असं दिसवर शी गॉट पजेस्ट अबाउट दिस वन पार्ट. आणि नेहमी काय मला मुलांचेच कपडे पाहिजे, मला दादाच म्हणायचं. त्या आई जे फार डॉक्टर आहे त्याला बदलायचे माइंड थॉट आम्ही तिला किती समजून सांगितलं, बट शी हॅज नॉट चेंज हर माइंड थॉट. So this was one of the aspects of how to find out. So the rubric was taken to this case. How I worked out this case. I had taken the first rubric is monomania. This mania for this mono, it is a mania, madness आहे. This one part. And she has डोक्यात एक भरलंय की मी मुलगाच आहे. अच्छा मला मुलगा आहे, मला मुला. This I had taken delusion. She possessed. This is one part. Delusion possessed is one part. Another that mannish habits in girls. This is part of the mannish habits in girls. And there is one more rubric. So I prescribed this girl remedy platinum. I prescribed this results still are working, but just remember how thought process about mind in a case. This one part of it. So you have to find out one of the main use of repertory to find out the needed symptom given by a patient. So it was a case by not my case. It is a case by Dr. Sarabai Kapade. He was one of the most senior most stalwarts of homeopathy from Mumbai. Not Sarabai Kapade. He was teacher of Dr. Rajan Singh. He has got lot of due importance to the concomitancy. And it was a case of one case that this Sarabai Kapade treating in a college OPD long back. It was a case of molluscum contagious. This case of molluscum contagious. You heard about this molluscum contagious. It is basically a viral skin illness. Commonly seen in pediatric practice. Commonly seen in summer season during जेव्हा मुलं जेव्हा नदीत पोहायला जातात, टँकला जातात. This is one of the part of contagious. Going from one child to another child, because the child who has got no immunity, he succumbs to this. And this is also commonly seen in HIV patients, molluscum contagious. This boy or students are taking down the case. So Student is taken down the case in detail about this nature of the child, desire, and everything. But prescribing on what symptom to prescribe, Dr. Sarabhai Kapade has got question in his mind. So after half an hour, he get fed up. Dr. Sarabhai Kapade says to her mother, child's mother, अरे भाई मुझे कुछ तो concomitant बताओ ना, on which I have to prescribe for this. तिने ताईला सांगितलं साराबाई की मला काहीतरी concomitant, तिला काय करणार concomitant म्हणजे काय ताईला. तर मग after half an hour this child go into sleep. तिला झोप यायला लागली. The child goes into sleep, and when goes into sleep, Sarabhai Kapade observed that this child started scratching her skull. He asked to the mother, why is he doing like this? So it is his usual habit. Whenever he goes to sleep, he gets itching in his skull. जेव्हा तू झोपायला जातो त्यावेळेला डोक्यामध्ये त्याला हाल उठायला. Then he opened the Repertory, Kane's Repertory. There is a rubric in Kane's Repertory. Where you find this in Kane's Repertory? Itching of a skull in which section? Head. So head मध्ये rubric काय असणार? Itching. Itching and then sub rubric is sleep on going to sleep. This is one rubric in Repertory. Sleep, head, itching on going to sleep. And there is only one medicine in Repertory. All the symptoms in Kane's Repertory are verified by Dr. Kane. Kane is mentioned about in the page. All the symptoms which are included in this Repertory or drugs are verified by me in practice. So that's why you can rely on Kane's Repertory. So there is one remedy in the Repertory that's called as Agnus Castus. The remedy was Agnus Castus. Normally we think of Agnus Castus as one of the remedy for impotence. But here this is something peculiar symptom. So Sarabhai Kapade prescribed Agnus Castus to this boy. And after 1 week, the whole molecule has followed now. This is what we mean. So this Repertory gives you the symptom which is given by a patient. There was another case where this patient has got complaint of stricture of urethra. No more symptoms are available in the case. One peculiar symptom this patient told about, I got only perspiration on my forearm. मला फक्त डॉक्टर एवढा तिथेच घाम येतो. मला एवढाच घाम येतो. I got perspiration only on my forearm. If you go and open the Kane's Repertory, perspiration forearm, there is one remedy is petroleum. And petroleum is one of the best remedy for urethral strictures. So on this basis, this remedy was prescribed was petroleum, and this stricture got better. So just remember this part. Remember this part. To find out the needed symptom given by patient. This is one of the main part of patient gives you some funny symptom. This is give another idea. Whereas there is in our college OPD, I was treating one case of psoriasis. This patient, usually I have to look into patient's eyes, mouth, tongue. And I find that this patient has got crack. This patient has got crack on tongue. Normally crack on tongue is where exactly this crack is mostly on the margin of left side of the tongue. Margins of left side of the tongue. And luckily this is only one remedy in Kane's Repertory. And we go into life space and history of this particular person. This person at age of 36, who has got 3 daughters and 1 son. Still he is doing some work in MIDC. All his doctor's education, taking the different schools, all the responsibility done by his father. 4 वर्षांनी मला मुलं कशी झाली, मुलं कशी वाढली, त्याला त्याच्या फारशी जबाबदारी नाही. All the responsibility is taken by his father because he has not ability to take responsibility. He just goes and work and came to home and give the money to the father. So this at the age of 36, also she is not able to understand what his responsibility is. What is one of the main part of the case was taking responsibility too late. त्याला लवकर लक्षात येते आपण रिस्पॉन्सिबिलिटी घ्यायला पाहिजे. तेवढं त्याची बुद्धी तेवढी चालत नव्हती. This was one of the aspect of a case. And luckily, if we just go into Repertory, cracks on left side of the tongue, there is only one remedy, Barata Kappa. So Barata, you know about it. Barata is one person, very late to take responsibility. And with the single dose of Barata Kappa, this psoriasis is totally gone. This is what we mean. Repertory gives you a remedy which you not thought of. That's all. Repertory gives you a remedy which you not thought of. This is that's one of the main use of Repertory. Is to find out the symptom given by a patient in a clinical practice. Patient says, doctor, there is one case of osteoarthritis, and this patient has got crack mark on the nose, tip of the nose. He was patient around about 72 age, and he is suffering from osteoarthritis. त्याला विचार आपण बऱ्याच ऑब्झर्वेशन पाहिजे. तुम्ही नाकाळाचे काय होतं, तो मला नाकाळाचं स्कार होतं. तुम्हाला स्कार काय डॉक्टर मला वारंवार आय गॉट रिपीटेड ॲक्ने ओनली ऑन माय टिप ऑफ नोज. ॲक्ने ओनली ऑन माय टिप ऑफ नोज. and he has got this right-sided osteoarthritis. Right-sided osteoarthritis. Another feature of this person, he was very sympathetic. He was very sympathetic to his family. He takes responsibility of whole family. Family मध्ये कुणाला काय झालं की याला चेंज पाडायची नाही. जोपर्यंत असा मुलगा वेळाने आला, सुनबाई वेळाने, she becomes very anxious. So he has got lot of anxiety for his family. So just try to understand, correlate this symptom. So if you go and open the repertory, acne on the tip of the nose, acne on the tip of the nose, there is one remedy in 3 marks in cancer repertory, posticum. If you attach to this sympathetic part and attach to this right side, you can get the exact remedy posticum. Put the posticum element potential 0/1 to 0/6. This patient get almost 80% better of his osteoarthritis. This is about how, but it is because of repertory I can able to find out this repertory has given some such a symptom. So that's why the main use of repertory, there patient is a patient काहीतरी any symptom सांगतो. Why to what? You stress to the brain. अच्छा, why to use stress to the brain? Just open the index. Now we have got softwares. Just click into the software. Just find out which are the rubrics for this particular case. Software मध्ये खूप हल्ली काम खूप सोपं झालं. Within second software can give a needed symptom in a case. This is one part. The second aspect of repertory is to study of Materia Medica. Study of Materia Medica. So I always ask the students when they study the Materia Medica, keep side repertory at your hand. तुमच्या साईडला repertory उघडी ठेवा. When you are reading any drug, always open the repertory. Suppose you are reading like remedy like lycopodium, you are reading the remedy lycopodium, and there is one aggravation 4 to 8 pm aggravation. So you always remember in your mind, for exams also, that 4 to 8 pm aggravation lycopodium. So this examiner what asks, which are the other medicines? Which are the other medicines which also have 4 to 8 aggravation? But you are not, because you have learned that lycopodium, you know only lycopodium. Due to what, at that time, if you have opened the repertory into general section, time usually 4 to 8 pm aggravation. There are other names like colocin, or there are so many number of other medicines. So ultimately, your knowledge of Materia Medica what it is. If you open the repertory, then you get more marks in your exams. That's why it is always ask the students, when you are learning Materia Medica, always open the repertory. Always open the repertory and study this. Always open the repertory and study this. Another part, study of Materia Medica means you take any rubric like anger. We study any rubric like anger and study all the sub rubrics of this. Study all the sub rubrics of this. Patient what says की डॉक्टर मला पूर्वी अशी घटना घडली होती, माझ्या काकाला मला त्रास दिला होता माझ्या वडिलांना खूप, तो राग माझ्या डोक्यात अजून जात नाही. सो आय ऑलवेज हॅज गॉट थिंकिंग ऑफ माय अंकल. माझ्या वडिलांना त्यांनी त्रास दिला होता, त्यांनी लोक शेतात वाटणी करून दिली नाही, त्या डोक्यात माझा राग सारखा जात नाही. दिस इज वन ऑफ द आस्पेक्ट. सो ऑलवेज सो दिस पेशंट इन हिज माइंड अँगर अबाउट व्हॉट की पूर्वी दिलेला माझ्या काकाने दिलेला त्रास तर त्रासाची माझी चीड आहे माझ्या डोक्यात माझी चीड आहे. दिस इज वन ऑफ द पार्ट. To go into a repertory, just find out angerच्या काही सब rubrics study केले. Anger about former vexation. Anger about former vexation. So there are 2 or 3 drugs into repertory. So one of the remedy was calculating anger about former. So that's how we just study one rubric anger and study all the sub rubrics. Study about all the sub rubrics. You can able to understand different features of anger of each remedy. Talking about lycopodium. What is the sub rubric of anger in lycopodium? Lycopodium has got one symptom, anger about absent person. Means what? Lycopodium is a king at home, whereas sheep, that's all. शेळी असतो पुढे ऑफिसमध्ये मोठा बॉस असतो, बॉस पुढे तो काय फार वाद करू शकत नाही, कारण बॉस बेसिकली lycopodiums are cowardized person. They are basically cowardized. They cannot able to confront with boss. पण घरी आल्यानंतर काय करतो, घरी आल्यानंतर बायको बरोबर बॉसवरचा सगळा राग काढतो. असा आहे तो बॉस लाईक दिस काय बॉस. दिस इज हाऊ ही makes an anger about his absent person. Basically why? Because he is not able to confrontation aggravation. He avoids the confrontation because he is a cowardized person. This is how you can learn each and every drugs through the repertory. Sir, my teacher Dr. Santosh, sir, he has made drug picture of each and every remedy through the repertory. Repertory is the picture of Materia Medica. So we have learned all the remedies from this particular part. Another part to study Materia Medica is to give another example like this. There is one rubric in the repertory. This rubric goes by like this. Undertake the things opposed to his intention. Opposed to his delay. Why it is not mentioned by this is one part of this. This is question in my mind also. There are some explanation are given by mind method people. His means the man. But the remedy was this another remedy. So this undertake the things opposed to his intention. If you just study this rubric, one rubric in case repertory, there is only one remedy. This is called as failed side of this remedy. There are two aspects of a remedy. One is on a positive side and the negative side. Positive side and negative side. So this particular remedy मध्ये कसं असतं तर ऑर्थोडॉक्स फॅमिली असते मी सांगतो कोणी मराठा असेल तुम्हाला घरात एकदम हे असते की यू हॅव टू मॅरी विथ दिस पर्टिक्युलर बॉय ओनली अशाच तुम्हाला काहीतरी वेगळं करायचं असेल तुम्हाला यू वॉन्ट टू डू पोलीसमध्ये भरती व्हायची असेल तुम्हाला UPSC करायची एक्झाम यू वॉन्ट टू डू समथिंग बेटर इन युअर लाईफ पण घरात तुमच्या ऑर्थोडॉक्स फॅमिली असते डॉमिनेटिंग फॅमिली असल्यामुळे तुम्हाला ते करू शकत नाही तुम्ही वडील म्हणतात त्या पद्धतीने तुम्हाला किंवा टू मॅरी विथ अ पर्सन गुड फादर लाईफ वडिलांना जे वडील सांगतात हे घर चांगलं आहे घराणं चांगलं आहे तुम्हाला याचं तुम्हाला लग्न करायचं तिच्या मनात ते नसते पण वडिलांच्या धाक्यापुढं शी हॅज टू मॅरी विथ दिस पर्टिक्युलर बॉय सो शी हॅज टू अंडरटेक द थिंग्स अपोज टू हिज इंटेन्शन म्हणजे मुलं होतात तर तिला मनामध्ये पद्धत राहते मला जे करायचं होतं ते मला करायला मिळालं नाही मला जे करायचं होतं ते मला करायला मिळालं दॅट्स वाय यू कॅन हॅव सिम्पल कॉन्ट्राडिक्शन ॲग्रिवेशन सर मनाविरुद्ध झाल्यामुळे त्याला राग येतात मग मुलांच्या बद्दल पण त्याला फार दया प्रेम असं दिस इज वन ऑफ द आस्पेक्ट ऑफ रेमेडी सो दिस रेमेडी व्हॉट आय एम टॉकिंग टू यू रेमेडी बरोबर सेपिया सो दिस वी गो इनटू रेपेटिटिव्ह रुब्रिक अंडरटेक द थिंग्स सेपिया हॅज गॉट मॅन लाईक क्वालिटी दॅट्स वाय इट इज मेन्शन हिज असं मेन्शन केलं अंडरटेक द थिंग्स अपोज टू हिज इंटेन्शन इफ यू अंडरस्टँड दिस पार्ट ऑफ द रुब्रिक दिस होल लाईफ ऑफ सेपिया यू कॅन अंडरस्टँड फ्रॉम दिस द हेल साइड ऑफ द सेपिया otherwise positive side of the sepia are very anarchist revolutionary it's a desire for a independent life अशी जगाला आवडत असते म्हणजे जगाला न मिळाल्यामुळे you can get this idea this compensated side of sepia this is but you can learn this from single rubric of repertory this one part another part about this repertory is just give an idea how repertory helps us to understand Mayasm itself there is one rubric shades of rubric like we are talking about irritability we have a rubric like anger rubric like rage. If you understand organ point of view, irritability is more an soric expression. You heard about it. Irritability is soric expression. Anger is a psychotic expression. And rage is a syphilitic expression. Anger is a way shades set. Irritability, anger, and rage. If you study medicine under this, like calcarica. Calcarica has got 3 marks under irritability. Calcarica has 2 marks under anger. It has got 1 mark under rage. How to understand this? Calcarica is a predominantly soric remedy. 2 number it is psychotic remedy. And 1 number is syphilitic remedy. This is how you have to understand. Or you can take another example like lycopodium. Lycopodium has got 3 marks in all these things. So lycopodium is predominantly soric, it is psychotic as well. This is triamiasmatic medicine. This is how repertory also helps to understand miasm through the idea of predation. The last part in this is to find out the stimulum. Means what? You have to take down the symptoms. You have to do the repertorization. After repertorization, repertory suggests to you. Repertory gives you group of medicine. Repertory gives you group of medicines. With this group of medicine, you have to select final remedy by consulting the Materia. Materia मध्ये त्याचा अभ्यास करायचा आणि select the proper medicine. So repertory suggests Materia besides. It is a bridge between patient and Materia. This was one of my first encounter in my practice. When I was doing my general practice. This was a middle-aged man. While sitting in a waiting room of a clinic, getting irritable over his wife. He gets very irritable wife. For different reasons. I am listening from my chamber. This man complained of pain in throat on right side with mild fever. On examination, right-sided enlargement of tonsils and pain better by warm breeze. When I asked to his wife, "What is the matter?" she said, "Whenever he gets sick, he becomes more irritable." जेव्हा असं आजारी पडतात तेव्हा खूप चिडचिड करतात. Luckily at that time I was teaching repertory to the students. One of the repertory can I go to synthetic repertory. You heard about it. So synthetic repertory means there is one rubric there. So this rubrics was taken like this in this case. I was doing general practice. This is all. But I know as a teacher of repertory, I know these are some of the rubrics of the case. So I tried to experiment on this. So okay, I option do okay patient. So I have taken this rubric. Irritability when sick. Irritability when sick. Right-sided complaint because tonsils are throat pain better by warm breeze. Throat pain better by warm breeze. Which remedy has got this? This first rubric may not be there in pain repertory. May not be there in pain repertory. So you have
Lacan.
So Lacan has got one of the features of Lacan I always remember is this. It is an alternating side. So alternating like sir tonsil is इकडे दुखते the patient काय म्हणते नाक हे गच्च होते का this one is alternating sides is one of the feature of laccan. So you have to be very because tolerability case है this was case of impotence we are not getting any symptoms of patient erectile dysfunction as a problem. We go into the past history में तुम्हारा क्या class होता है he said I have suffered from tonsil. What is characteristics of during that time? यदि क्या saying मैं tonsil दुखता नहीं था इकडे दुखायला इकडे on that basis this particular person prescribed laccan and with the laccan impotence he got better. But this is all been that in the past history you may get some characteristics. That's all past history. So in this if you just open the repertory in synthetic repertory there is a rubric called irritability and under irritability sub rubric of irritability will 6 irritability will 6. This is what why this symptom is take to be repertorized. Irritability common aspects आहे पण आपण काय सांगू ज्यावेळी आजारी पडतात तेव्हा त्यांची खूप irritability वाढते. So this is symptom not only a common symptom irritability is a common symptom but why it become characteristic on basis of intensity. So any mental symptom become common mental symptom can be characteristics on basis of its intensity. Obstinate children it can be common children are often but if you got child who is too much obstinate too much obstinate you can take this for it. Otherwise this obstinate unless and until it is very predominant symptom prominent symptom then and then you can take this symptom because this is a 3-mark symptom in a patient as well as in the remedy also. So irritability when sick you just go into synthetic repertory जो अभ्यास करता है synthetic repertory mind में जाओ mind irritability when sick the remedy was given by Dr. P.S. Smith. Who was P.S. Smith? P.S. Smith was Dr. student of Dr. Kane. He was with Dr. Kane from first edition to the last edition. P.S. Smith has worked each and every along with the wife of Dr. Clara Lewis Kane बरोबर P.S. Smith ने काम किया. Then P.S. Smith has written one more repertory, final general repertory by Dr. P.S. Smith. This is called as 7th edition of Kane's repertory. So P.S. Smith has so all the additions which are made by P.S. Smith are very reliable additions. So remedy was prescribed to this patient was lycopodium. So there is only one remedy in synthetic repertory, irritability, sick vein, lycopodium. 3 marks there. This is one part of it. So on the basis lycopodium was given to this person, he got better with this tonsillitis. This is one of my earlier experiences regarding I am doing experimentation in my practice. So for a case of my father, and I was just that time also I was teaching the initial days of my practice. He was suffered from eczema on the left ankle. Eczema too long-standing eczema, and he was not getting better with all sorts of the steroids and antihistaminics. This is one of the story of this. One day संध्याकाळी सकाळच्या वेळेला तो पेटवत असताना I was just observing my father आणि मग आमच्या आईला म्हणाली वैताग आला so I get fed up of this teaching and all this sorts of discharges and नको झालं मला जन्म नको झालं. Actually what is this patient talking about this is simple eczema and he is talking about total fed up नक्सल नको वाटते मला आयुष्य. This is one of the aspect of this. So this is what it is a perverted mind. This is part of the perverted mind. This rubric is we are talking about is despair. This is called as despair. Despair कैसा बरोबर है itching of skin बरोबर. Part of itching of skin. So this despair is out of proportion reaction. That's a common expression. Despair is out of proportion reaction. And हमारे discharge are very offensive. My father was intensely chilly. जरा ठंडी पड़ने के लिए स्वेटर करना, ये नॉर्मल पानी करना, कानाला टोपी करना. This was the basic state of this person. So how to understand this part? Again, you अभ्यास करायचं म्हटलं की there are 3 symptoms. You want to prescribe any remedy in any case, you should have at least 3 symptoms. You should have at least 3. This is called as 3-legged approach. 3-legged approach. So 3-legged approach was mentioned by Dr. Johnson. So this is called a 3-legged stool. Right? In stool तुम्ही stand करायला तुम्हाला at least 3 leg पाहिजे. Johnson काय म्हणाले की एखाद्या in any case you should have good one mental general characteristic, one physical general characteristic, and one political characteristic. So 3 पाहिजे something. Then you can make your prescription. Like you're talking about one case like where this person is very dictatorial. This person has got desire for sweets. And this patient has got cracks on heels. One mind, one body, and one part. The remedy is lycopodium. So my usual teacher, doctor, always when you want to prescribe lycopodium, ask the patient show your heels. Heels lycopodium. Lycopodium is just going to gain therapy. Cracked heel, there is only one remedy lycopodium to gain therapy. Heels cracked lycopodium. This is what we are talking about. Three-legged approach. In this case, I have taken to get all our general symptoms. Display with itching of the skin, offensive discharges, and chilling. With remedy. This Soranum. This Soranum you go into cane therapy with 3 marks remedy. With 3 marks with Soranum. With the Soranum, this patient, my father got almost all eczema is totally better. I have seen this better for last 6 to 7 years. Similarly, one of my friends, when I was doing my internship in homeopathic, government homeopathic hospital in Mumbai. There is only one homeopathic, government homeopathic hospital at Mumbai, CMP Medical, Vijay sir used to came here for as a social service to this OPD. One of my friends was suffered from long-standing cough. He has consulted to one of the best chest physician in Mumbai. He has prescribed initially at diabetes around about 96, 97. He prescribed initially at amoxicillin. 4-5 days amoxicillin, but no any change. Then he prescribed ciprofloxacin at that time, but no any change. Her cough was increasing. माझा मित्र जेव्हा सरांच्या पुढे बसला होता, सो मी काय बरा होणार नाही आता, काय हातून खोकल्यात मी जगत नाही असं मला वाटतं. सो दिस वॉज अ रिॲक्शन ऑफ दिस माय फ्रेंड विथ सिम्पल ब्रॉन्कायटिस, simple bronchitis. So only this listening to this story, Vijay sir prescribed me aurum Materia. Prescribed aurum Materia. Suicidal thoughts, melancholy with this simple complaint of bronchitis. With single dose of aurum Materia, this patient is and pain was on the same night the work is totally better. So this is what we do. This you know about this sad, melancholy, despair with the complaints of the aurum Materia. So you have to understand this. This was again my initial days of practice. There was a girl studying in the 12th standard in arts. Complaint of skin problem, pityriasis versicolor. What do you mean by pityriasis versicolor in Marathi? This is commonly seen in summer season. With unhygienic conditions. In the unhygienic conditions, you are not properly maintaining your hygienic conditions. But this is another fungal infection, no doubt about it. Then fungal infection. In Marathi, it is called as surma. You heard about it? Surma. This pityriasis versicolor. He has got pityriasis versicolor on part of the chest and the back. Not responding to the antifungal treatment. You have to understand this one part. What I observed is she is very simple. Very simple. Very name. Name म्हणजे काय? What is name? नियम म्हणजे तुम्ही भोळेपणा. तुम्हाला कोणी इझिली डिसीव्ह करू शकतो. एकदा फसला तर परत आणि तुम्हाला कोणी फसू शकतो. तुम्ही त्यातून शिकत नाही. अशा नॉर्मली आपण शिकायला पाहिजे. मोठे आपण फसवलं गेलं तर परत तुम्ही त्यातनं धडा घ्यायला पाहिजे. दिस नेम पर्सन का वन टू ऑलवेज गो लर्न करत नाही. दिस वन ऑफ द पार्ट ऑफ दिस. सो व्हेरी नेम गर्ल. सो व्हेरी नेम गर्ल. Very childish in nature. Enjoying herself playing with the small kids a number of times. During her 12th standard, studying in 12th, the arts मध्ये. When she came from the college वर यायची घरी आली की लहान पोरांना घ्यायची आणि खेळत बसायची. आई ओरडायची, डॉक्टर बघायचं लहान पोरांना खेळत बस. लहान पोरं गोळा करायला दिले त्यांच्यावर खेळत बस. So her basically nature of this girl. She get very much affected by horrible scenes on TV serials. म्हणजे काय टीव्ही सिरियल एका तुमच्या भयानक पिक्चर बघितला, मारामारी खून बघितली, तर त्याला रात्री झोप यायची नाही. आईला असं चिटकून झोपायची. डोळ्याकडून मला तेच so I see all the horrible things in front of my eyes. This was her nature of her, and she gets sleepless nights. And she also has got craving for pencils at age of this girl has got intense desire for pencils. Indigestible. This is one of the parts. So Udri was taken like this. Udri was taken to this case for childish behavior. It's a normal childish behavior. Normally, it becomes characteristics. In a 12th standard girl, she behaves like a child. You can take as a more characteristics in her. In a adolescent, childish behavior in old age will craving. This girl has got one feature of childish nature. Start with childish nature. Another part is name. She has got very name. She has got horrible things. As a rubric after it. Horrible things, sad stories affect them profoundly. The rubric बऱ्याचदा आपण practice यूज होतो. This rubric is commonly used in practice. काय सांगतात बऱ्याचदा की डॉक्टर पिक्चर बघितले डोळे झाकले की डोळ्यापुढे तेच दिसायला लागतं. So delusion sees horrible image on closing the eyes. The rubric name gets it. Delusion sees horrible image on closing the eyes. This is one of the part. Horrible things that will affect her profoundly. So she may get fright, she may get sleepless nights, she may get same thoughts in her mind. This is how this rubric is like. And craving for lime and pencil, marking pencil pencil. This is the remedy you are thinking in this case. Normally, which remedy has got this? Alumina.
Calcarea alumina.
Calcarea alumina. So this calcarea alumina doesn't have what is child-like feature. One of the main feature of alumina is confusion of her identity. This is one of the main aspects. मला डॉक्टर मी कोण आहे मला नेमकं काय करायचं आहे म्हणजे कळत नाही. So it might be because of the domination by parents. All the decisions are taken by parents and he is not able to decide this. This is typical comes as alumina. So alumina feels I am not able to decide for myself. मला नेमकं काय करायचं हे माझं मलाच कळत नाही. So this is part of. We can have this confusion of our own identities. Alumina has got this desire for lime and pencils. Another remedy is calcarea. Calcarea also has got this feature of childish behavior. Calcarea has got feature of not much childish, marked feature of horrible things that will affect her profoundly. And this craving for lime and pencils also covered as calcarea. This neo part of the name, this is आधी भोळे म्हणतात भोळे. This भोळे part is not much seen in the calcarea. Calcarea that we just see one rubric or division, two exclusive, you can go वेगळी आहे. This is one of the part like calcarea has got features like close to platinum. I am too exclusive, I am something different. मला त्या शेविंग त्या नव्याकडे जाऊन त्याकडे जाऊन मला शेविंग करायला मला असलाच कपडे पाहिजे. This choice you can see in calcarea. There is one, how to understand this remedy, how to understand. I have learned this remedy from Dr. Vijay Krishna. There is one rubric into cancer. There is one rubric into cancer. Delusion, cancer epidemic delusion. Just listen to this rubric. Delusion, being again a child. So I have to understand, read the rubric properly. Delusion, being again a child. So again म्हणजे काय तुम्ही परत you are going back into child-like state. There is a defense mechanism you have heard in a psychiatrist. There is some defense mechanism like rationalization. It is called a denial. You have heard about this. All these defense mechanisms are essential for our day-to-day life. आपल्याला day-to-day life साठी आपल्याला एक defense mechanism गरजेचे आहे. म्हणून तो you have heard about this thing. कोल्याची गोष्ट द्राक्ष आंबट आहे त्यामुळे काय खाल्ले नाही. This is part of the denial part of this. Here the main rationalization. This defense mechanism, there is one defense mechanism called regression. This is called regression. You heard about suppression, ऐकला suppression, regression. This is called as regression. What do you mean is delusion being again a child. You are going in the back like into child-like state. So in this remedy that what I am discussing with you, there are 3 or 4 reasons why this remedy go into child-like state. So I am talking about the remedy called as Sikuta Viroja. This remedy, Sikuta Viroja. Sikuta Viroja is one of the remedy, prominently remedy for childish behavior. Part of childish behavior. And in Sikuta there are certain causes. In Sikuta, one of the main cause under Sikuta is one of the remedy for severe convulsions, epileptic convulsions. If any person come to you after epileptic convulsions, she behaves like a child. You can think of Sikuta. Secondary to convulsions. Convulsions might be one cause. Another cause in Sikuta is fright. Another cause in Sikuta is fright. You have sudden intense fright, you become a child-like state. You become a child-like state. तुमच्या आजोबांनी तुम्हाला काही गोष्ट सांगितली. गोष्ट सांगितल्यानंतर तुम्हाला एकदम ती भीती वाटते and you are behaving like a child. This is fright is another element in Sikuta. Third element in Sikuta is head injury. After head injury becomes behaving like a child, you can think of Sikuta. Without any cause, in her case, it is without any other cause. She becomes a child. She becomes lower character. So on this basis, remedy was prescribed for Sikuta Viroja. But Sikuta Viroja are not complete. Sikuta can cure this fungal infection, but it has cured this fungal infection. So Sikuta is one of the main remedies you can think of for this childish behavior adult girls. That's all. So I have got one intern student. I was taking clinics in my college. She was in a hostel. And she suddenly developed मला कॉल असं मुलगी हॉस्टेलमध्ये काय करते काय त्याला फीटचा त्रास व्हायला. She has suffered from convulsions. And means I have visited to her room. What I find in a bed, at least there are more than 40 to 50 teddy bears. Teddy bears असे ठेवले होते आणि त्यात ती झोपायची. This was her nature. So I know her nature. This is one part. So this how to understand this part. So at the BHMS intensive मध्ये तेवढी teddy bear घेऊन झोपत होती. So this was rubric in a repertory. Desire to play with childish toys. Desire to play with childish toys. And this was a girl. And now she has done his MD medicine in psychiatry. This girl has done MD medicine in psychiatry. Now she is doing good psychiatry practice from Jawara. Then is postgraduate. So this remedy was given off in terms of Cicuta girls. So this Cicuta has got this feature. So Cicuta actually, another part about Cicuta just given now by mathematics. Calcarea has got this desire for light and pencil. It is because of lack of nutrition. That's all in Calcarea. Whereas in Cicuta this is what's behind Cicuta variable. Cicuta variable, it is level of mind. He cannot able to discriminate what is eatable and what is non-eatable. Just remember this. You know, at my class in the examination, what is the difference between Cicuta and Calcarea cap? So Calcarea cap, it is because of nutritional part. He has got his desire for this. Whereas Calcarea might have an anemia, but Cicuta, he at the level of mind, he cannot able to discriminate. Like खायचं काय नाही, म्हणजे eatable and non-eatable. His discrimination is lacking in Cicuta. That's why Cicuta has got this desire for indigestible. So this is one of the aspects in a homeopathic practice. I always try to learn, take a follow-up in detail. This was a girl who was suffering from Nicoderma, suffering from very close to Cicuta. Just remember, what is suffering from? She was doing well with the remedy X. At that time, she features का girl, she was very affectionate. Affectionate means just like phosphorus, pulsatilla, carcinosis, very prema affectionate. Affectionate means in the sense what? She has got friends at all. She is doing his 7th standard of 7th or 5th standard. And she has got friends at all classes. From the हवी पासून तिसरी पर्यंत सगळ्या मुलांची ती मैत्रीण असते. सगळ्यांच्या पर्यंत जाऊन मिक्स व्हायची. That is quality of this particular girl. Very affectionate, try to go into each and every group. सगळ्यांची लाडकी होती. She always to be in a groups of all the friends. This one affectionate. Very friendly with everyone. Very vivacious, very jolly. You are talking about causal. कल होना हो कुठल्या काजल अभी काही त्यामुळे काजलचे जे पिक्चर आहे दिस कॉल्ड विवेशियस बबली गर्ल दिस part of bubly vivacious very changeable disposition this part of changeable means like pulsatile that pulsatile either she becomes angry she becomes sleepy this alternately mind becomes angry changeable disposition so this is actually theme of Lily Floric family मध्ये this remedy belongs to Lily Floric family this remedy belongs to Lily Floric family मध्ये तुमचा लिलियम टीग आहे मराठन मालगोमा you heard about this remedy so after 2 years she was almost 80% better with this remedy. She was 80%. The remedy was in it thought in your mind. This remedy is very close to phosphorus. This remedy is very close to pulsatilla. Pulsatilla has got changeable disposition. Pulsatillas are not so much affected than this remedy. Phosphorus मध्ये तुम्हाला don't find changeable disposition. So this remedy was Proctus sativus. Remember this. Proctus sativus is the remedy prepared from saffron. This Proctus, this remedy was prescribed to this girl. And with this Proctus sativus was almost 80% better. After 3 or 4 years, after this case was very long, from 7th standard to her first year BSc of teaching her, she has got Nicoderma, majorly part of the body, and almost 100% better with this remedy, Proctus sativus. After 2 years, she was almost 80% better. And came with a new complaint. Sleepiness since last 2 months. Sleepiness since last 2 months. Interesting part about this, we are talking negative part. When she starts studying, her sleepiness improves. Normally आपण अभ्यास करताना आपला झोप येते बरोबर आहे तो वर्गात सर शिकवायला आले की आपल्याला झोप यायला दिस इज युजुअल पॅटर्न ऑफ दिस सिमिलरली विथ द क्लासरूम when sleepiness improves during lecture begins. Lecture सुरू झाले तिला झोप किती निघून जाईल. So this is something interesting part of this. She said a rubric like this. Rubric like this in the repertory. स्लीपीनेस बेटर बाय लिटररी ऑक्युपेशन. अच्छा, तुम्ही अभ्यास करायला आला किंवा शिकायला आला की तुमचं झोप निघून जाते. So at that time I just opened the repertory, just find out is there any symptom like this. It's not given in Kent's repertory, synthetic repertory. You go into synthetic repertory, third chapter, third volume, synthetic repertory, 3 volumes are. Sleep मध्ये जायचं. Sleepiness better by mental exercise. Sleepiness better by mental exercise. Which remedy is this? This is what you have to understand this. During follow-up also try to find out. Same remedy is coming in your case. The same remedy is coming that this remedy is the correct constitutional remedy. So remedy was, after searching the repertory, there is only one rubric in the sleep section, complete repertory. Sleepiness better by mental exertion. Only one remedy is proper survival. The same remedy is coming into this. And in Materia it is mentioned like this. Drowsiness stabilized by literary occupation. Patient improves well with proper surveillance. So it confirms proper surveillance constitutional remedy always take during follow-up. Same remedy state still persists or not. Dr. Sarkar, the master of Materia, always used to say, प्रत्येक follow-up के बाद उनकी new case, you have to take the case as if it is you are taking the case as the first time. Try to find out whether same remedy is coming or there is some change of symptom. You have to change the remedy. ऐकू येईल? ठीक आहे. This lady girl get better with both her complaints. Sleepiness as well as lipodema. But that what I will learn from this case, during follow-up also try to find out whether the same remedy is coming or not. In this case, what the remedy was coming was proper surveillance. So proper is one of the remedy. Think of when you are thinking of pulsatilla, phosphorus. This is one of the very affectionate patients. They are very affectionate and changeable dispositions. Now another feature of proper, just remember this for the additional knowledge. Proper people always like to sing. तर कुठे गाण्याची ट्यून लागली त्यांच्यामध्ये परत सिंगिंग डिझायर टू दिस इज पार्ट ऑफ दिस इज वन ऑफ फीचर ऑफ प्रॉपर सगळ्यात ते गुणगुणायला लागतं गुणगुणाचं ते वन ऑफ फीचर ऑफ प्रॉपर दिस इज अनदर केस दिस केस ऑफ मॅनेजर ऑफ HDFC he was suffered from this asthma. What is feature of this asthma? Difficult breathing aggravation by knee elbow position. Desire for cold drink. This combination desire for आंबट आणि गोड आवडते desire for sweet and sour, desire for sweet and salty. This is combination you find in which food item. त्याच्यामध्ये तुम्हाला सगळे स्वीट सगळे टेस्ट बघायला मिळतात. In which food item you find this all the taste combined together. गोड पण असते, आंबट पण असते, तिखट पण असते. पाणीपुरी. This was a verified symptom by Dr. Santosh. Desire for panipuri, 3 mark symptom of this remedy. Desire for you just see this combination of taste. And this patient has got hairy body. Hairy body म्हणजे काय? अंगावर पूर्ण असं केस अस्वलाला कसे केस असतात तेवढे असे अंगावर छातीवर पाठवतात. Hairy body feature of psychotic malady. Excessive hairs is feature of psychotic malady. You go to Patil's repertory, there is a rubric called as hairy arms. Hairy arms, excessive hairs. Which psychotic repertory मध्ये तुमच्या डोळ्याकडून कुठल्या कोणीच तुमच्या आम्हाला बेटर This case that this patient has an intense love for animal. This patient has got intense love for animal. Which remedy? Just first position better by knee elbow position. This is the actual position of this patient. He feels better by this position. To go into repetition of this, difficult respiration lying knee elbow. Love for animals, these are for sweet and sour, these are feelings and emotions, So Medica can use, this might be a constitutional remedy. Sometimes Medica we can use as intercurrent medicine. You have heard about this, intercurrent miasmatic option. So you can use as constitutional remedy. So the case our college opened. She has got, she came to our OPD for renal calculi. She came with frequent attacks of yawning, followed by jerking movements of lower jaw. These attacks came in interval of 5 minutes. It started suddenly in the morning. She came to our OPD at 10:30 a.m. During attacks, she stretches her lower limb. Just observe it. Now, this video is better. So, usually this is in a college setup where she has done this for at least 4 to 5 times. And it started since 10 in the morning. She came to our opening for 10:30 in the morning. So these are the jerking movements. It starts with yawning. Somebody agent, so actually picture of this. So initially what we think of this is, so I have discovered Sina. Considering this Sina may associate with relevant simply yawning as accompaniment. So but Sina and it doesn't work in the case. Nothing but Medica. So after Sina, no any change in her. After 1 hour, no improvement. She gave more information. She was suffering from some problem 3 years back, for which she has concentrated in neurofibrillation. Then our brain clicks. It is a case of convergence. It is a case of focal convergence. In case of temporal lobe epilepsy case. And she has what is focal convergence. So basically we are dealing with a case of neurological case. Observe this neurological case. She was better about this statement, but she had discontinuity. After that, she came into epileptic status epilepticus. This is one part. So these are all focal convergence. They are not generalized convergence. These are only focal part. So we consider this is case of convergence disorder. So convergence starts with yawning. This was the rubric which gives me entry into this case. Convergence with yawning. And we have find out this. We complete repeat the rubric like yawning in a convergence. These are the remedies under this. We have to study all the medicines. So I studied all the medicine under Boric Materia. And this one remedy comes for this homoeopathic. So Boric has mentioned this remedy often relieves the temporary epileptic condition. Stretching and yawning with hiccups means hiccups are nothing but this spasm. Conversions are nothing but spasm. Stretches are most common. This is not conversion with first dose. Whenever she get this complaint, we are given this SOS dose of this homoeopathic. Whenever she get conversion, you can take this. Dissolve in water. Later on, you have consulted again to the neurophysician and started her anti-epileptic medication. If you are but one of my case in my general practice. At minimal AM, this lady came to me with sudden trembling of right upper extremity, where she just gone to sleep. झोपायला गेली आणि तिचे हात असे हलायला लागले. The lady was not answering to my question. त्यांना विचारलं काय झालं? Young lady काय बोलत होती? त्याची चेहऱ्यावर सुस्त सुंदरपणा असतो चेहऱ्यावर. काहीच बोलत नव्हती. She is in a binary state. After repeatedly asking, she said, मला भीती वाटते. ही स्टोरी अशी होती. This case. असं हलत होतं. ट्रेनिंग. स्टोरी अशी होती. She has got history of college. Just recently married. नवऱ्याबरोबर भांडण झालं. Recently college. इव्हिनिंग संध्याकाळी नवऱ्यावर वाद झाले. कॉलेज and evening fight. Since then, she was in supervised and not responding to him. She got intense fight. नवरा रागवला आणि नवरा खूप शिव्या वेळ दिला. तेव्हापासून त्याची घाबरूनच गेली. झोपायला गेली हात झाला. So here I have to understand this. There is a local trembling. Trembling it is part of it. Basically, it is a neurological case. Neurological. And what is caused in this is fight. Causing this fight and the expression of a patient's state is a benumbed state. Facial expression is banned. After giving this homeopathic medicine, you are finding out within 5 minutes, trembling stop. Trembling stop. So remedy, which was the remedy? Element from fight. Which remedy? First thing in your mind is aconite. So aconite does have what is benumbed state. Aconite you can find intense amount of fear, restlessness. How it is? You can find anxiety, anguish on the patient's mind on the aconite is done. Disease. In this case, the patient is in totally benumbed state. So these are the rubrics which are taken in this case. General trembling, general fright form. Extremity trembling, general upper limbs. Extremity trembling, general fright upper. Stupefaction as if intoxicated. General is paralysis, general fright, single part. So the remedy was given an opium. Opium 30 potency dissolved in water. 3 doses she was much better. One or two cases. So the case of cervical spondylosis. Just remember how Repertory helps us. Whenever she gets into complaints of cervical spondylosis, all the common symptoms of cervical, patient has got pain in neck, other pain sickness, all the common symptoms of cervical spondylosis. But one peculiar symptom this patient mentioned about this, since this development of this complaint, this patient has got itching in ear while eating. तो क्या कहना है कि मैं जेवायला आली माझ्या कानात खाज होती जेव्हापासून त्रास सुरू झाला आहे. So this becomes a concomitant symptom. What is concomitant symptom? Which cannot be explained on basis of anatomy, physiology, or pathology. It is only time relation. No, there is only time pattern. So in the case Repertory, there is rubric called itching ear, eating while. There is only one remedy, Lachlan plus Kentoria. This is remedy from boring maternity. Just read this boring maternity, you can find this remedy has got all the symptoms related to cervical. This patient got better with this. So here Repertory makes us to unlock the case. That's why given us something, which is something peculiar symptom here. So last case of my college student, he was suffering from multiple filiform knots. Filiform knot means दाढ़ी वगैरह बारीक सामटे होते हैं. So initially I tried this person lot of constitutional medicine like calcarea, silica, but no any change in them. What he did that sir की दाढ़ी के लिए वाला से bleeding होते हैं, उनकी दाढ़ी करो सकते हैं. Multiple filiform knots on the face. And what is he mentioned about his past history? The past history ऐसा होता है कि he has got measles 2 times in the childhood. And during measles he has to admit. Normally measles से कोई admit करते हैं. But her complaint during measles, she has got intense vomiting and dehydration. Both the times she has got vomiting and dehydration, he has to admit to the hospital during time of measles. So in Kent's Repertory, there is one rubric called as vomiting measles during. In the Kent's Repertory, stomach, vomiting measles during. There is only one remedy. There is only one remedy. This remedy is antimonic rule. 3 marks in the Kent's Repertory. Stomach, vomiting measles during. This is how we have to past history. You know about past history, but we as homeopath, what we have to understand in the past history. What are the symptomatology during past history? Not only just naming the name of the disease, it is not essential. But we have to understand what are the symptoms. So this symptom might give you idea about this present remedy. That's all. So I am just giving you one more case about use of past history. The one case of Dr. L.M. Khan. Dr. L.M. Khan is one of the best teacher of organ in Calcutta. Retired person. Dr. Shankaran, it was a case of Dr. Shankaran. This case patient was suffering from rheumatoid arthritis. And case was not getting better with Sir's treatment. So Sir has consulted Dr. L.M. So Dr. L.M. you have heard about the word anamnesis. You heard about the word anamnesis. So we have asked about how it started. So what this person really talked about this. We started 6 years back. I was suffering from entry fluid. Then he asked, what are the symptoms during entry fluid? So then this lady gives answer. So on the first day of entry fluid, I got severe diarrhea. On the first day of entry fluid, I got severe diarrhea. Then fever goes on increasing. Then it is diagnosed with a case of entry fever. And after I am getting better with entry fever, then I slowly started paining joints. So this was an anamnesis of a case. So how it started? So on this basis, remedy was given by Dr. Rastox. So why Rastox it was given? You just go and read Allen's schema. There is a mention like this: diarrhea at beginning of entry fever. Diarrhea at beginning of entry fever. This is on the basis of past history prescribed this Rastox to the present ailment, and this got lady got better rheumatoid arthritis. So this is how it is. I have to learn both parts. So in this case, Repertory helps me. There is only one remedy in Repertory about omitting measles urine. This is one part. It is not common feature of this, but this in this case was predominant symptom. This is how Repertory helps to us in day-to-day practice. So make a habit of reading Repertory day in and day out. One of the teacher, Dr. P.S. Smith, who is called as one of the best teacher of Repertory, he said, I almost consult 100 times in Repertory in a day, more than 100 times in a day. So then only Repertory becomes your good companion, it becomes your friend. Unless and until you know this rubrics of Repertory, it is not possible to see in a patient. You know, like, what is the example Santosh? Like college student, right? Student, they do in general practice. To pass out BHMS, it takes almost 9 years because you are not intellectually keen. But he has got desire that I should be a doctor. A doctor बनायचा. Doctor बनल्यानंतर त्यांना general practice started general practice. And he was suffering from asthma. And every time he came to me for OPD, he just go and सारखा रडायचा. Sir, माझी जनरल प्रॅक्टिस आहे. रोज 3-4 पेशंट होतात. मला तर पैसे भरपूर कमवायचे. माझं प्रॅक्टिस का फास्ट चालत नाही. माझं प्रॅक्टिस फास्ट चालत नाही. 4 पेशंट 3 पेशंट झाले मला एकदम उदास बाहेर होतो. अच्छा always she has got the same thought. माझं प्रॅक्टिस का फास्ट चालत नाही. And he was suffering from asthma. During asthma, whenever he get asthmatic attack, he get OBD. Asthmatic attack followed by OBD. So there is one rubric in a Repertory. Sadness when business doesn't go fast. Sadness when business doesn't go fast. ते rubric कुठून आले? This is not rubric recently rubric clinical rubric. This is rubric written by H. T.A. Allen original proving the rubric आहे. That's why this is one of the reliable rubric in practice. Just remain not in practice. The original proving symptom. Sir, sad melancholic when sadness when business doesn't go fast. So there is only one remedy in this Repertory of Ipecac. You know Ipecac has got no case for asthma. Ipecac has no vomiting. This person get totally better of his asthma with Ipecac. But this mind state they are keeping. This is constantly in this particular doctor's mind. Why my practice doesn't go, my business doesn't go fast. This is one of the part of this Ipecac. Another part of this, why this particular doctor, he was very capricious, just like part of Chamumula, and you heard about Sina. If you go into a Repertory, there is one to be capricious, there is one Ipecac 3 marks. This is how we have to understand this other aspect of the case of optimizing. This is how Repertory is one of the tool which makes us our practice become enjoyable. If you know the Repertory, day in and day out. So make an habit of opening the Repertory. जहाँ तुम्हारा वेळ मिळेल त्या Repertory open करा. Repertory make an habit of reading the rubrics from mind section up to gender. It is not only mind. You can go into each and every section of Repertory and make an Repertory your best friend. Then it becomes your best friend in your practice. So I like to thank Dr.Santosh Patil sir, Dr. Ranade sir, and all the teachers and all of you for your patient listening. Thank you.
Question and answer, you can ask question or your questions. Yes, please, any questions? We definitely have one photo session with sir after completing the lecture.
Suppose that tomorrow, a difficulty that as well. Homeopathy practice is so easy. If you go and dive into this, you can go and dive into it. म्हणजे काय? Homeopathy practice असं सहजासहजी होत नाही. तुम्ही शिकले बऱ्याच अवॉर्ड्स करू शकतो. मला जर इन्स्पायरेशन यावं म्हणून सांगतो की डॉक्टर सरकार म्हणून आहे आमचे टीचर कलकत्याचे, ते नेहमी अमरावतीला येतात. नागपूर टू अमरावती 4 hours जर्नी आहे. ड्रायव्हरला काय सांगतात, तुम्ही बसलोय का, तर तिथे गेल्यानंतरच काय बोलायचं, की जस्ट ओपन द बोरिस मॅटेरिया मेडिका, जस्ट रीड दिस बोरिस मॅटेरिया होल ट्रॅव्हल ॲट द एज ऑफ 70 years. At the age of Dr. Farooq Master, he used to go to the OPD in the 4 in the morning, 4 a.m. He studied from 4 a.m. to the 9 a.m. in the morning daily. After completing 50 years of practice. You heard about Dr. Mohanty, Dr. Vijayakar. They used to wake up at 3 a.m. in the morning and they study the rubrics for at least 3 hours continuously. There and then only this, their practice is such a lowering practice in all. So homeopathy is not an easy job. You have to do hard work, but if you do the hard work, it gives you a lot of everything in life. So you have to give back to the homeopathy. Homeopathy काय देतात पण तेवढंच महत्त्वाचं. Then when homeopathy give back to you.
Okay, I hope you people don't have any questions. You can ask afterwards. So I'm very thankful for the next lecture by Patil sir. And what I was feeling, my rubrics, I was feeling like child again. Because 20 years before I was attending his lecture and I got the same feeling. So again, the same experience going back. Actually, since yesterday I got so many rubrics. I was very highly apprehensive today. I had invited sir and today's Rangapanchami. I have much more apprehension, anxiety, sleeplessness, all the rubrics coming in a row. If you don't come, then it will be a total super. I had invited him. But thank you to all the students. You had attended sir's nice lecture. Now, just a small session I will conclude. Small section I will conclude in 10 minutes. With 10 minutes I'm going to conclude because today is Women's Day. And our college is, I think, a Women's Homeopathic Medical College, almost. So, as a part of celebration of Women's Day, let's give a small 10-15 minutes lecture. I know. Baap ki baat beta kya bolega. Sir gives so nice lecture. So I have very little to say, but as Women's Day, principal sir asked me to say something. Today's Women's Day special. Now, what is importance to be a woman? We are living in Kolhapur and we are praising Ma Mahalakshmi, Adi Shakti, or Mother Goddess. Oh, why our forefather think that we should pray God as a female, as a mother? You know, our entire world, there are so many gods and they all are male. But why we feel, especially in Kolhapur, that Adi Shakti, Jagat Janani Mahal, why we felt that need of a mother goddess? Because to be a female is not true. A male got only one birth at once, a real birth, and one hormone, testosterone, lifetime at a constant level. And female got a 3 birth. Original birth, energy is a second birth. Entirely the chemical environment of the body had been changed, and the third is the menopause. So her body changes 3 times, 3 births in one life. So many painful situations, menses, pregnancy, and so many things, so many pain. To be a mother is a divine, because she suffered a lot. That's our forefather thinks that we should pray to God as a mother. And it is a simple experience that spiritual seekers are telling that if you ask the father in difficulty, it's a pretty less chance that he will look attention. But you simply cry and your mother runs to you to help you, to rescue you, to help you. So in a way, to be a female is not true. And especially today we are going to focus on menopausal syndrome, because it is an inevitable part of our life, female's life. So what are the objectives of today? Understand a menopause physiology, how we work, because I am a physiology teacher. My first thing is that we should understand a physiology. recognize menopausal symptoms. Review investigation and management and explore the role of homeopathy. Now, this is my ultimate aim of my investigation. So, what is menopause? And you should understand that the permanent cessation of menstruation due to loss of ovarian follicular activity. So, as you know that in male, spermatogenesis is a continuously lifetime process, but in female, the gamete generation happens before the birth of the baby, and the stock is given before the stock of female follicles is before the birth, and they got reducing, and when this completely ovarian loses all the follicle, we call it as a menopause. Occurs usually between age of 45 to 55 years. Average age for the Indian is 50 years. Average age of it. Now it's varying. Nowadays these things are changing because of early menarche, early menopause. As we know, early menarche, menarche depends on a weight, not the chronological age. Physiology does not know the calendar, but physiology knows the weight. So menarche depends on weight. As the nutritional status is improving, the girls are getting early menarche. Early menarche is invariably early menopause, and that's why this age is changing. Because the age is changing, stage around the menopause. Now, as menopause is not a one entity, menopause is not a one entity. It is a pre-menopause, perimenopause, menopause, and postmenopause. So, understanding menopause, you have to understand all the stages of menopause. Pre-menopause, what is pre-menopause, what is perimenopause, what is menopause, and what is post-menopause. Hormonal changes. So, what happens actually? Why menopause? Estrogen goes down, progesterone goes down. Why estrogen, progesterone goes down? Because the ovaries are no more follicles. So, no more estrogen, no more ovarian hormones. Why? Pituitary goes on secreting FSH in LH in order to increase the level of estrogen and progesterone. You know the negative feedback mechanism. So, in order to stimulate the ovaries, our pituitary tries to give more and more stimulation. No, depletion of ovarian follicle, no reduction in estrogen production, and endometrial changes. These are basically three things happen during the time of menopause. Types of menopause. Oh, what are the types of menopause? Natural menopause, which can occur. You know, this is a common thing. Natural menopause. Premature menopause. Oh, premature menopause and premature ovarian failure. There are two different entities. They are clubbed together as premature menopause. Surgical menopause. Hysterectomy, oophorectomy, or premature surgical menopause, and delayed menopause. And the other condition, other extreme, is that delayed menopause of menses continuation after 55 years age. It's called the delayed menopause. So premature menopause, after before age of 40, also called the premature ovarian failure, but there is a slight difference. Technically, these two things are. Ovarian failure may resume the menses again. So premature menopause and ovarian failure are little bit technically different things. Premature ovarian failure leads to so many complications. As early loss of hormones leads to early ITD, early osteoporosis. Causes of premature menopause. First, genetic disorder. Some genetic genes could be if the mother and grandmother or any genetic linkage is there, they have identified the genes also. I'm not going to do it. Second, the autoimmune disease. Now, we have homeopathic point of view, psychosymptomatic background, and the ovaries get damaged. Anti-oocyte antibodies are there, and so many types of antibodies are there. They can cause that. Some infections can lead to the premature menopause and chemotherapy. While treating other part of body's cancer, we are giving a chemotherapy agent. So many chemotherapy agents are known to cause premature menopause. Lifestyle factors: smoking, stress, and environmental toxins. No stress. Here the homeopathy comes in. So many stress are there in life, especially female life is full of stress. Answer says that. You suppose you have some ambition and your family has some different ambition for it. And then there are the actions. Everywhere female has to adjust. So the lifetime adjustment is achievement is the art of it. Achievement will not happen without adjustment, but if there is no achievement and adjustment are fruitless, they are only going to increase the stress and environmental toxins. We had added so many environmental toxins. Simply fair and lovely. Fairness cream. They are not harmless. Why should we look fair? Because we are ruled by Britishers for 150 years and we believe that the Britishers are good, Britishers are fair and they are good because they are fair and we want to become fair. But Ram was black, Krishna was black. You say, okay, what is there to male? So Kunti was also black. For her the entire Mahabharata happened and Sita was also black for her Ramayana happened. So black is a beauty, but we want to become a fair and we are adding the estrogen and progesterone extra in the form of fair and lovely. That's why now they had changed the name Glow and Lovely. Now they have to understand, okay, this is discrimination against Indians. To make the Indian fair is a discrimination. So they had changed the name. Then they bring Mardovali cream. You know Mardovali cream, that fair and handsome. That is nothing but estrogen free. Estrogen is the only thing which can increase your fairness. So they, though the boys are so enthusiastic to fair, they started applying the fair and lovely and they start getting extra estrogen and they start getting changes in their body. That's why the company understand and they make the changes in the product. But this kind of environment is including plastic also. Plastic contains bisphenol A. Bisphenol A is the precursor of estrogen. So plastic can converted into straightway into estrogen when you drink water in a plastic bottle. These plastic bottles are highly harmful. You are not drinking the water, you are drinking flask along with estrogen. Estrogen goes to water. Bisphenol A get converted. That's why there is a full grade plastic, pharma grade plastic. So the girls drinking water in a plastic or eating in a plastic, they develop PCOD very early. Surgical purpose after hysterectomy, bilateral nephrectomy. Now hysterectomy indicated or unindicated is always a question of debate. So many debates nowadays. Government is forcing laws on hysterectomy. It is needed because unnecessary hysterectomies are so many. So many non-indicated hysterectomy. There are hundreds and thousands of cases. Even simply, when I was practicing in Jaisingpur, there was one kind of nature in girls that, okay, 2 children are there, we are going to remove the uterus. Why we are going to remove the uterus? Because we don't want menses for the religious reason. For the religious reason, we don't want menses. That was extreme. So 24, 25 years age and they had removed their uterus. It is surgical suppression. It is entirely wrong thing. But doctors were doing that and government had acknowledged that. If I want to focus over there, why menstrual cycle and religion is again as female World Women's Day, you should know that. What is the idea of what is the relation of menstrual cycle with religion? Dharayanti sadhana. The religion makes your life easier in this world and that world. Dharayanti sadhana, protect your life, to make your life easy. In older days, there was work on physical level. And on the occasion of festival, hundreds of people were gathering and to cook the food was a difficult job. Pani udhal lagayacha, zatyavar daran naraal lagayacha. Too much hard work. And menstruating, bleeding lady, if done the hard work, there is a pretty good chance that she will land into the shock syndrome, and shock can cause death. So in those days, they want to prevent death. How to prevent it and keep the woman healthy? So they declare that, okay, if you got a menses, देवाला चालत नाही. देवाला चालत नाही म्हणून तुम्ही तो राणी विश्रांती घ्या. काय करा विश्रांती? काही करायचं नाही म्हणजे काय करायचं विश्रांती घ्या. सो विश्रांती घ्यावी आणि तिथं डेथ टाळावं. त्याचा प्रिव्हेंटिव्ह अँड सोशल मेडिसिन. प्रिव्हेंटिव्ह अँड सोशल मेडिसिन डेथ टाळणं हा धर्माचा उद्देश आहे. मृत्यू टाळणं. बट काय होतंय? मुली जातात हार्मोनल पिल्स घेतात. काय सण आहे पुढे ढकला पाय. अशा हार्मोनल पिल्सचे साईड इफेक्ट मला माहित आहेत का? व्हॉट कॅन हॅपन? येस काय होऊ शकतं? Blood clot होता. Estrogen is highly prone for blood clot. That's why plastic is increasing incidence of ISD, blood clot, clotting tendencies. Secondly, malignancy, prone for malignancy because you are adding, you are not giving hormone, you are giving hormone analog. What is the tablet you are giving is not it's a synthetic hormone. Hormone something is not a chemical, so it has so many side effects. So it's not a great topic. But उपाय काय? आज वुमन्स डे आहे. तुम्ही मुलगी तुमच्या आली तर काय सांगणार? तर बसवेश्वरमध्ये संत होऊन गेले. त्यांनी सांगितलं की भस्म धारण करा आणि करा पूजा पाळीच्या काळामध्ये. बसवेश्वरापेक्षा तर आपण शाणं नाही. आणि मग इंग्रजांची गोळी चालली तर बसवेश्वर भस्म चालला काय प्रॉब्लेम आहे? सो हा बदल केला चालला. वुमन्स डे व्हॉट मेसेज ऑफ वुमन्स डे that religion has nothing to do with menses. It is only thing related to the health. नाही तर मग चित्रगुप्त पाप पुण्याला बसवला तसं बायकांची डेट द्यायला म्हणून अजून एक एजंट तयार करून ठेवा असं होत नाही. सो आणि हे तुम्ही करायला पाहिजे लेडीज डॉक्टर. तुमच्या जेव्हा पेशंट येतील तर त्यांना सांगा की दिस इज नॉट द इंटेंट ऑफ इट. दिस इज नॉट द इंटेंट ऑफ रिलीजन इज टू कीप द हेल्थ नॉट टू डॅमेज द हेल्थ. सो दिस काइंड ऑफ unnecessary surgical oophorectomy, unindicated oophorectomy. Menopause after age of 55. So what are the problems with delayed menopause? We are going to discuss in detail. Common menopausal symptoms. So what are the common symptoms? The hot flashes. Now this hot flashes is because of lack of estrogen and progesterone. And what is trying to raise with the FSH, compensate with the raised FSH, night sweat, palpitation and fatigue. Now these symptoms occur in variable relation. All the women do not feel the symptom in equal proportion. This symptom can vary from very mild to very severe. Now psychological symptom: irritability, mood swing, anxiety and depression. Now looking at this symptom, now forget these are the pathological symptoms. Can you find this rubric in the repertory? What is your answer? Yes, because our repertory is a clinical repertory. At the time when homeopathy was growing, 80% rubric you can find in the ICU only. Because in those days when homeopathy was growing, the person get admitted in the homeopathic hospital was staying in homeopathic hospital till death. मरेपर्यंत होमिओपॅथिक कडेच पोहोचायचा, त्याकडे दुसरा ऑप्शनच नव्हता. आणि त्यामुळं what our masters had observed, our repertory and our metamedical contains so many symptoms which are actually nowadays patients are sitting in ICU, which have never come to the homeopathic OPDs. But these clinical rubrics you can find in our Medica. So if you look very carefully in the repertory, you can get all these rubrics. Only thing is that homeopathy had added more to the gynecology is that there are modalities. If you pick up the modality of this rubric, you can give best results. Irritability, mood swings, anxiety and depression, and so many psychological symptoms. Modern medicine got some limitation. Homeopathy is again modality. All these symptoms with modality, then it become homeopathic case. So case treated by gynecologist, case treated by homeopathy. What is the difference? They focus on a symptom, we focus on modality. And modality makes the symptom characteristics. Sleep problem, insomnia, night awakening, sweating. No, disturbed sleep is a really bad symptom. Last night I am experiencing that. I was worried, you people will come here or not. Rangopancham is there. What will happen? Every engineering that will lead to sleeplessness. Now consider, one night sleeplessness is so toxic. The female is facing the sleeplessness for years. And what? The way she is going on. You know, if you don't sleep for 3 nights, consecutive 3 day and night, if you don't sleep for 3 days and 3 nights, what will happen to your immunity? It will so depress, it's more, you are immunosuppressed more than HIV. More than HIV, you are immunosuppressed. Sleep had got so many role in your immune reaction. And that's why the sleeplessness creates so many problems in the female. Now, urogenital symptoms, vaginal dryness, dyspnea and urinary complaints. As I am happy to have Dr. Patil sir with us. He is practicing sexology. I think I am right. Now, this symptom is really tough. Because the hormonal changes, because of menopause, there are so many sexual symptoms and female are going to confess with you, especially the female doctors. So you should know that. Now, this symptom, you know what is the world record of oldest lady conceived? सगळ्यात वयस्कर बाई जी कन्सीव्ह झाली तिचं वय किती होतं? वर्ल्ड रेकॉर्ड नॅचरल कन्सेव्हिंग किती असेल एनी गेस? सगळ्यात म्हातारी बाई जिला नॅचरली मूल झालं असा वर्ल्ड रेकॉर्ड काय असेल? किंवा रेकॉर्डेड जगातला रेकॉर्डेड एनी गेस? 50? Any guess? It was only 73 years and older. It was in California, America. It's a record in 1941. At the age of 73 and years and 9 months, she conceived and given a live childbirth. Now I think you people are understanding. But after menopause, because of vaginal dryness, the question becomes painful and the things become so tough for the lady. While in India, like a traditional societies, there is no value to the female feelings. And that's why these symptoms are tough to treat. And they are not able to express in front of family, in front of male doctor. That's why there is a separate topic. So there are different topics on this. What is contraception at the age of menopause? Post-menopause, perimenopause and post-menopause contraception. Is it required? Yes, fertility is drastically low, but it is never sure. And if some lady get pregnant at that age, one of my friends, she's had happens, and she got one lady coming with her daughter-in-law for the obstetric treatment from Gandhinagar. She was a senior. And she was doing routine, and her daughter-in-law got 8 months. And she confessed to the gynecologist that, yeah, I got some worm infection in my abdomen. Worms are filled my abdomen. Unfortunately, the gynecologist put ultrasound probe, and the daughter-in-law was having 8 months, and mother-in-law was having 9th month. बडबडून गेली हो, म्हणून समजत होती ना की ज्याला ती वर्म समजत होती. आता जर इथे जर गायनेकोलॉजिस्टने फॉर्च्युनेटली प्रोब ठेवला नसता तर काय झालं असतं, व्हेरी हाय चान्स ऑफ डेथ मदरच्या. कारण कळलं होतं तिच्या डोक्यात, कारण एकतर पाळी बंद झालेली आहे, प्रेग्नन्सी राहणारच नाही. त्यात गांधीनगरमध्ये तुम्हाला माहित आहे मस्त एवढं पोट असं असतं की माणूस आधी याच्या अगोदर पोट पुढे येतं, मेल और फिमेल, त्या हत्तीत पिल्ली. प्रेग्नन्सी कळलीच नाही एवढ्या मोठ्या पोटात. आणि नॉशिया असलं की त्याला काय पित्त झालंय आपल्याकडे, व्हेरी कॉमन. आणि शी वॉज प्रेग्नंट. देयर वॉज नाईस मूवी बधाई हो. हॅव यू सीन दैट? बधाई हो. So this kind of things can happen, and all these things are coming to you only, you as a practitioner, you as a homeopath. So people will come to you about asking the questions, and you have to answer those questions. So urinary symptom, incontinence is invariably common post-menopausal nowadays. Because of lack of pelvic floor strengthening exercise, lack of Kegel exercises, there are getting so many urinary symptoms. Urination on coughing, it is common most remedy. Urination on coughing, ostium, acetylene, so many is there. So long-term complication, osteoporosis. No, osteoporosis, high bad fracture. Which are the area prone for fracture in female body after menopause? Hip, worst fracture, less common but more complicated. A second is a spine. Common fracture is the spine component, wedge compression of spine. Wedge compression of spine is common. Cardiovascular disease, I see up till before menopause, she is almost immune to the cardiac disease. Post-menopausally, she is prone for cardiac disease equal to the male. Then cognitive decline, emotional cognitive decline. No, that's why the daughter-in-law is a pulse pillar and mother-in-law is a lycosis. Why? प्रत्येक सासू सून असताना म्हणते मी असं वागणार नाही, आणि ती ज्यावेळी सासू होते त्यावेळी ती तशीच वागते, क्योंकि सास भी कभी होती. Why this happen? Because of cognitive decline. Now this is again a special topic from the neurophysiology. Why cognitive decline happens? Because of lack of estrogen. These ladies are very prone for depression, then Alzheimer and Parkinson's. Incidence increases drastically. Investigation, FSH, estrogen level, and thyroid function test. These three things you should always look for at the time a menopausal patient comes. Additional test, ultrasound, bone density, and hormonal profile. Bone density is a very essential test. You should do the post-menopausal woman looking for osteoporosis. Osteoporosis is really bad. Chronic pain, chronic back pain. Homeopath, common female come. All the जाहिरात, कुठची जाहिरात बघा, मूळची बघा, कुठली बघा, ती वा आऊच सगळी असते, ती लेडीज असते वा आऊची. आणि कधी तो बाबाजीच्या पटलीला काहीतरी ते लावत असतो. कुठला आयोडेक्स. No, why? Because of they are prone for osteoporosis. Bone density is the essential hormonal profile. Differential diagnosis: thyroid disorder, adrenal disorder, pituitary disorder. You should understand orgasm of menopause. Is this a real menopause or it is all this endocrine disorders? General management: exercise, balanced diet, and calcium. So there is one concept called as sarcopenic obesity. So sarcopenic obesity. After the menopause, the muscle mass reduces. Muscle gets converted into fat. So ladies start gaining weight with reduction in muscle mass. And this way, when cardio करतो आम्ही चालत जातो, it will have no health benefit. It's only treated with the weight training. So what exercises are recommended are weight training rather than cardio type of exercise. Calcium, vitamin D, balanced diet, psychological support, counseling, family support, and stress management. Now here come in the role of it. And Sir had nicely described it. Thousands of rubric. Repertory is full of the rubric which you can utilize the menopausal syndrome. Hormonal replacement therapy, estrogen progesterone therapy. These are common therapy nowadays. Estrogen progesterone therapy is almost outdated. Estrogen only therapy is recommended, but so limitation, risk of cancer, thromboembolism, and long-term. That's why many gynecologists prefer homeopath to refer the cases to manage the menopausal syndrome. Bad menopausal syndrome, you will definitely as a homeopath, you will get referral from gynecologist. because they are not willing to give HRT long time. They know that is a thromboembolic phenomenon. Even the cases going to the physician, medicine or cardiologist, they are always going to ask to stop the HRT and go to the homeopath. So as a homeopath, you will experience and you have lots of cases referred because menopausal syndrome symptoms are tough to treat. Why homeopathy, holistic treatment, individual approach and self-therapy. Now we don't have those problems of thromboembolics. Principles of homeopathy, you know that I am not going to. Homeopathy is taking look at the mental symptom, physical symptom, and particular serve that tired. Important remedies are sepia, indifference to the family, hot flushes, BHMS sensation. Like hot remedy, left-handed complaint cannot tolerate light clothing. Pulsatilla, you know that, no need to tell us. But a pulse, what pulsatilla is puberty graphite is in the menopause. Don't forget graphite is in the menopause. Sulfur again, burning heat, standing. Hot flushes usually above the breast, the upper half of the body. Menopausal hot flushes. If somebody start telling about the hot flushes in the leg, it is less likely that these hot flushes are menopausal. This is more than 0% or something else. But these hot flushes typically limited to the upper part of the body. Remedies nitromood, silent relief, hormonal headaches, Calcaria carbonica, these are common remedies. I am not going into detail. Remedy selection based on totality of symptom and individual constitution. Classical benefit of homeopathy: reduction in hot flushes, better sleep, improves emotional health. Advantages: non-hormonal, safe and robust. So here you should do homeopathic medicine. Also you should have a counseling activities. You have to counsel about all those aspects of contraception. As well as one other condition is that post-menopausal, if some female need pregnancy, especially death of child, then you have to go for a pregnancy. It is possible, yes, it is possible with IVF only two-side donation. But can they work as a surrogate mother post-menopausal woman? Again, the answer is yes. So lots of things are going on. Lots of research is going on. If you are really interested in this, then go for this nice book called Menopause, available in our library also. Menopause. It is written by Neeraj Goyal and Gupta. Nice book, Menopause. There are so many topics: osteoporosis, your symptomatic treatment, cancer screening. At post-menopausal, the risk of cancer is so much. The cancer of breast and cancer of uterus, cervix are very common, and you should clinically do screening with every case, especially CMS. It is the worst type of cancer, CMS. Always, even preferred you should, as a male doctor, you are not able to examine the ladies. But you can keep a pamphlet how to do self-examination. And if they reported any swelling in breast, ask to go for mammography. Now again, in mammography there are so many things. Dense breast, C type and D type breast. Up till now we were considering that mammography the gold standard for screening of breast cancer. But if the C and D type of breast mammography fails, then you need MRI test. So suppose your mammography, they had mentioned that the breast is a C-type breast or C-type breast or dense breast. Don't rely on mammography. It's having low predictive value in dense breast. You have to go for a MRI. So cancer screening at the age of menopause is very, very essential. Advantages non-hormonal. Clinical experience: many menopausal patients improve with individualized treatment. With the experience of last 25 years, I can say that menopausal syndrome we are today. Rather say we are past. Summary: menopause is natural but symptomatic. Homeopathy offers individualized treatment. So master the menopause. Go through the repertory. Search for the rubrics. So I am going to show you what is there in Repertory. Does there any clinical rubrics useful in the repertory? See, take pause for repertory. So there are rubrics in repertory. 2 minutes we are just going to look for them. There are rubrics which are useful for the clinical practice. Kate Repertory, female genital health. Pain in vagina, position urine. There are symptoms. You can get this rubric, very common rubric. I think sir can put 2 minutes light on this rubric also. Yeah, there are so many patients coming with this kind of complaints. Next. Okay, genitalia female atrophy ovaries. So this rubric you can use in menopause. So many remedies are there. Iodum, Marita, Moraticum, Conium. Now, okay, female genitalia position enjoyment absent. Now this is a perimenopausal state. Enjoyment absent because of change in hormonal environment. Enjoyment absent. There are so many, especially the posticum and sepia. We know the sepia, but 3 marks posticum. Now here remedial differentiation you should put on. Sepia is very common remedy, but sepia is not alone. Posticum, hair metallicum, medullarium, then bromium, then phosphorus. Position aversion 2, again perimenopausal symptom. Natrum arsenicosum sepia. Then female genitalia cracks. This is very because of dryness there are cracks. Nitric acid works best. Now this cracks is presented as urethritis. Urethritis, burning, intense burning while urination. But ultrasound is a normal. Ultrasound is a normal. Urine routine is a normal. No UTI. Again UTI is a different topic. Different. No UTI and still burning. Then this is urethritis. Nitric acid works. Female genitalia desire increase old woman. No, decrease also as other part is the increase in old woman. We got a moscus. Now, this kind of rubric you cannot neglect, and this kind of symptoms you should not neglect. Then excoriation aged woman, excoriation aged woman work. Now these are single remedy rubrics are very useful. Female genitalia heat, hot flushes, menses during, ovaries, uterus, so many rubrics. What I want to bring your attention that our repertory is full of clinical rubrics. Insensibility, vagina, postmenopausal one complete. Insensibility, ferrum, ferrum adytum, phosphorus, sepia, berberis and bromium. Then sleeplessness old woman, old people, sleeplessness. This is the already useful problem. Next. Then hair falling out, female genitalia hair falling out. This is very common. Again, hair and menopause is a big topic. What is the female pattern hair loss? Male pattern hair loss almost every male in our college is also started feeling it. Male pattern, but female pattern is a different. Female genitalia. So leukorrhea, bloody leukorrhea. What is could be possibly? It's a malignancy. Most probably malignancy. You should look for it. Not always. You should look for it. No? Then menopause itself is a rubric. You can take this rubric clinical rubric. Menopause, female genitalia, menopause. So many remedies. No? Then menses copious aged woman. So this is very common. Aged woman because of fibroids and leiomyomas. Then platinum is works best in that case. Female genitalia menses copious menopause during menses copious menopause during Lagos, Sepia, Medica, Lycasis, Sabina, so many remedies are there. I think you are getting a clinical rubric now. In Kate Repertory, it is not famous for clinical rubrics. Menses painful dysmenorrhea, climax is near. Now near menopause, perimenopause, these are the rubrics. Sorinum, now here you can think of sorinum, which is quite a rare choice of drug. Sorinum. But characteristic, 3 marks. Metrorrhagia, aged woman, again Calcaria, Ignitia, Mur. I think this must rubric are in. No. Metrorrhagia, climatic period, Calcaria, sulfur lycasis. Okay. Anyway, thank you for listening patiently, and I'm again simply requesting that menopausal women, you should not neglect, you should not avoid the symptoms. Age is not an exception. You cannot neglect anybody's feeling only because of it. So thank you for your attendance. Can I request Patil sir to give 2 minutes?
Dental program.
हो ठीक आहे सर. नेक्स्ट
I'll be
टाइम
taking separate.
येस सर आपण सेपरेटली बोलूया आपल्या ह्याच्यामध्ये. ही कॅन डू डिफरंट ही स्पेशालिटी. Human sexuality is entirely a different topic, and in menopause that become very important, very characteristic symptoms, full of symptoms in the repertory. So once again I am thank you for attending, and I am thankful to our principal Dr.Santosh Patil sir for giving us chance, and all of you. Again, this is voluntary activity. We have not made any voluntary compulsion on you to attend, but still on a Sunday morning you people come. I am very thankful to all. I am thankful to our favorite Deepak for giving us technical support and all those. Once again, thank you very much. If you want to ask any question, you can ask yourself. आणि दीपक नंतर सरांबरोबर आपलं एक फोटो सेशन घेणार आहे. त्या बाहेर गेलं सरांबरोबर फोटो काढल्याशिवाय मी जायचं नाही. त्याच्याबद्दल सरांबरोबर फोटो
सगळ्यांच्या अटेंडन्स लिहिला.